Oh, fucking hell. I'm a numpty. Yeah. Oh, rejoice, comrades! Some random geek is lurking in the void. Watch out for the tardigrades, geek. Hi. No, Kev or Helena. Weird. So you've got me. You've got me early, even though my joints are currently yelling at me. Huh? Oh fuck. Yeah, I'm on. Ah, motherfucker. Cardiac. Oh, no. Treadmill. Oh god. Oh god. I have no idea if there's one for NHS. Oh, British Heart Foundation. 10 years old. Do 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 do. Do. NHS. Fucking hell. This is gonna be a cleaning it. What's he doing? Right. Oh. Go there. Good. Whoops. Hmm. Ah, no, I was just um promoting myself. You first, as always. Getting into the pattern. Yeah, yeah. No props, darling. Ooh, farmers market on Saturday. The between 10 a.m. and 5 p.m. So we go out for lunchtime and get better quality fruit and veg. And a variety of other things are usually there. So Saturday might be quite fun. And I can tell you what I got up to during the day. But yeah, whatever's easier for you, obviously. Cool. Stupid bastard brands, I fucking hate them. Cool, cool. Oh, fucking hate that. Uh, that'll sneak up on me at some point. Okay. Well, we wait to see if more people filter in. Because I just shelled myself now, so we'll give people until 20 past. Mind you, in saying that, this video's only 3 minutes long, so if people come in after it's finished, I can always play it again. That Leeds one might be fun. My joints hate me. Oh, the video we're going to be watching to start off with is what I went through. Fuck, nearly 12 hours ago. My knees and my ankles still haven't recovered. I went through eight of these, so I'm over 4.5 litres of juice, plus 3 coffees and about 2, 3 teas. Maybe all the caffeine. It's a lot of fucking water. Raptor Colin. So he wants more organised chaos, does he? Depending on what the topic is, I might call in. Why are you moaning at me? I've not killed you already, have I? They're less than a year old. My wireless mouse is flashing like a demon at me. Oh! Non-movement. There, you happy that I have to move you every so often? It was not. Oh yeah, yeah. I came in a little bit late. Yeah, I got the. I came in after it, not long after it, and I looked at all my fucking hell. Where did all those points come from? Because I was literally had hardly any points left or blue bucks. I thought, holy fuck, and I'm back over 40,000. So that's fun. We get to annoy Raptor with succulent Chinese meal. I like that one. That's my favourite. Oh, this is Democracy Manifest. Cool. It's a shame you can't refund the bits and stuff that we've put in. But at the end of the day, that's technically part of it is not his. I can't remember what the percentage is that we get. Probably not enough. Because my mum had an appointment today as well, and I've been trying to get through to her for the last week to tell her I was going on the stress test today. She didn't know I'd went through it until I managed to get through to her at about 7 o'clock. And I told her, and she just freaked. They done what? Said, well, it will take a while for them to collate everything. You'll find out in about a month. Fair enough. They were more worried about my joints than they were about the actual heart and stuff. They're doing this to all women over the age of 35 to 60, and they're working their way through the age bands. So they probably got done with the 35s to 45s first, and because I'm 46, I'm in the next sweep. So 46 up to 52, then 52 up to 53 up to 60. Texted my sister, and she literally yelled at me through a text. Literally all caps, like 5 full texts. Why didn't you fucking tell Mum I was trying to? Rejoice, comrades! Limey Redneck is here. Hi, Limey. We are doing the health issues of being old as balls. I went through a cardiac. The technical term is an echocardiogram stress test. Shanna, Limey, Shanna. My joints hate me. Okay. Oh. they'll just do an echo in him. I don't suspect. How old is he? I don't think they'll put little puppers, little doggle through the stress test that they put us humans through. We're a different beast, obviously. But if they do put Simons through that, I assume you have pet insurance. I would assume that. So, just the echo, yeah. It's funny them putting it all back because with the blood clots they had to do. They done echoes on me when I was in the hospital. So I've already had an echo. I've had several echoes since March now. So I had several echoes in the space of like a week, essentially. Having blood clots on the lungs, not good apparently. Who'd have think it? Mm. That's better. Oh. Shall we? Can everyone hear me? Oh, that's good. I can hear the video even though my phone's just kind of lost reception. But my Wi-Fi has, and that's odd. We're still getting the little tail ends of Storm Florist. If you hear me say Florist, Shanna, I've got it paused. Oh, I'm a fucking moron. I know what I've done. Give me a minute. I'm a moron. I was playing Hades. I was playing my game earlier on, and I mustn't have switched it back over to the speakers. Idiot. Sound. Speakers. Thank you. 1, 2, 3, go.
This film will show you what to expect if you are having an exercise ECG, often called a stress or exercise test.
My name is Gerard Dunn. I live in Surrey and I'm a builder by occupation. I'm here today to have a stress test because they found that the rhythm of my heart isn't working properly.
My name is Parisha Khan and I'm a cardiac physiologist at St George's Hospital. An exercise ECG is basically a test to see how the heart performs when it's under stress. So what we're looking at is the electrical activity of the heart and also blood pressure changes while a patient is walking on a treadmill.
Out of sync.
A bit apprehensive about it, but at the same time, I've got to think of the future. Whatever a hospital needs to do to get me back to full health, I'm willing to go for it.
We prepare the patient by asking them to remove their top clothes, and if you're a female, you'll be given a hospital gown. We'll put electrodes on the chest, and they'll be hooked up to an ECG recording and a blood pressure cuff around their arm. They'll be asked to walk on the treadmill. Every 3 minutes, the treadmill will get steeper and faster, and during each stage of exercise, we measure the blood pressure. You happy?
Yep.
Good. We try and encourage the patient to do as much as they can, but obviously they need to tell us if they have any symptoms at all. And we'll also be monitoring the blood pressure, the heart rate, and the ECG. The test from start to finish, for the patient coming in, being set up, and from them actually leaving the room, it takes about half an hour. If the patient's had enough, or if we see anything significant, the machine is slowed down, and then we recover the patients for at least 5 minutes. We want your blood pressure and your heart rate to come down
4, 5,
to how it
4,
was
5.
before we started. Obviously, you need to catch your breath first as well.
The test was fine, but as the minutes went on, I could feel pressure and my breathing got a lot faster.
Once the blood pressure, heart rate, and ECG go back to pretty much as it was to start with, we end the test and then the results are sent to the doctor.
The advice I would give them to, if it's been recommended, go and do it. Listen to your doctors.
Heart disease is still the single biggest killer in the UK. But for over 50 years, we've tirelessly pioneered research that has helped transform the lives of people living with heart and circulatory conditions. Join our fight for every heartbeat in the UK. Every pound raised, every minute of your time, and every donation to our shops will help make a difference.
Oh, it was at St George's. Huh. Usually comes up with suggestions. Oh, right, it's all the videos if you want to watch. Huh. How to pass. The reason you get sent for these is not to pass them, it's to check the fucking heart. It's not a test like written down. God almighty. Seriously. Oh dear God. I knew this would fucking happen. I do apologise, comrades. Oh. Damn, we're gonna do it. Where are they? Where are they? I will take these off. I will be back momentarily. 1 minute. Ha! Sorry about that. Take you out, you can go there. Huh.
What is vascular dementia? Vascular dementia is the second most common type of dementia. It is caused by problems with the blood supply to the brain. Nerve cells require oxygen and nutrients to survive. Without them, they will become damaged or die. Cells are provided with oxygen and nutrients by a network of blood vessels in the brain. When the blood supply to the brain is interrupted, for example by a sudden blockage or a leak, this is called a stroke. A stroke can cause significant damage to parts of the brain. When the parts of the brain responsible for memory, thinking, or language are damaged in this way, a person will have difficulty remembering things, thinking, or speaking. These are all symptoms of vascular dementia. Sometimes, a single large stroke is enough to cause the symptoms of dementia. This is known as post-stroke dementia. This scan shows damage to the brain of someone with post-stroke dementia. In other cases, a person may experience a series of smaller strokes that gradually cause damage. This is known as multi-infarct dementia. Following a stroke, a person's symptoms may remain constant for a while. Then, if the person has another stroke, they may notice a sudden worsening of symptoms. This is known as a step-like progression. Small vessel disease is where there is a narrowing of the blood vessels deep in the brain. Small vessel disease is the most common cause of vascular dementia. As the narrowing affects more small blood vessels, and more of the brain becomes damaged, the person will experience a gradual loss of abilities. Usually, people with small vessel disease notice a slowing of thinking and problem solving. For example, taking longer to think of a word and write it down. Evidence suggests that lifestyle factors that promote a healthy blood supply, such as regular exercise, not smoking, and eating a healthy diet, could help to reduce the risk of vascular dementia. There is currently no cure for vascular dementia. However, by controlling underlying cardiovascular diseases which affect the blood supply, such as high blood pressure, high cholesterol, and heart disease, it may be possible to slow down the progression of the condition. Vascular dementia will affect people differently, depending on the parts of the brain that are affected. However, a common symptom is having problems with planning and organising, or with concentrating. It can help to break complex tasks down into smaller steps and to make sure that environments are not too busy or noisy.
That's what that's the cause of death for my granny. To my mum's mum. And my dad's, both my grannies. They were really old. Great granddad. No. No, he was. That's a stroke for him. So my great granddad, my granddad's dad, one foul swoop, massive fucking stroke. Well before I was born. I think my dad was a toddler when he died. So he would have died in the 50s. Well before I turned up on the scene. But he was a gone, austere, cruel man apparently. My granny didn't like her in-law. My great granny, so my dad's granny, she had already died before my dad was born. Probably been married to that man. But she was Canadian, by the way. So my great granddad, he was born in Scotland, but he moved over to Canada, married a Canadian lassie. Got married, had my granddad. Then they moved back over here when granddad was something like that. So 15, 21, 29. So granddad 20. So I don't know. So granddad moved here to Scotland when he was a toddler, which was in the mid to late 20s. He was born in 22 in Canada. Oh, yeah. What happens during a stroke? Oh, there's the...
Here in the lab, we obviously have some pretty incredible organs to show you, like this one here, the human brain. This is the command center for pretty much everything you do. It's calling the shots for your thoughts, your movements, and even your ability to process all the anatomical awesomeness from your viewing of Institute of Human Anatomy videos. But what happens when something goes wrong with the brain, like during a stroke? A stroke is one of the leading causes of death and disability worldwide, and it can hit fast, sometimes with no warning. So today, we're diving into the anatomy of a stroke, as we're going to show you exactly what's happening in the brain, why it's so dangerous, and how it's treated. And most importantly, what you can do to lower your risk. I'm Jonathan Benyon with the Institute of Human Anatomy, and it's time to get into this anatomical awesomeness. First, let's define a stroke. A stroke occurs when blood flow to part of the brain is disrupted, starving brain cells of oxygen and nutrients. Without oxygen, brain cells start dying within minutes, like 4 to 6 minutes. And that's why strokes are medical emergencies. And there are two main types of strokes: ischemic strokes, where a blood vessel gets blocked, and hemorrhagic strokes, where a blood vessel bursts, causing bleeding in or around the brain. Hemorrhagic strokes are less common, about 15% of cases, but they're often more severe. And since ischemic strokes are the majority, we're going to zoom in on those first, but we'll circle back to hemorrhagic strokes a little bit later.
The ischemic ones are more common type of what the vascular dementia. Essentially, that's a small localized clot. It could go anywhere. The hemorrhagic one is a massive blood clot, which could have happened to me. Terrifying. And that the clot forms somewhere in the body. Mine's formed in the leg, and it moved up through the circulatory system and sat in the lungs. Well, there was a few of them. And from there, there was ones in different parts, which means it could have been the oxygenated blood going up to the brain, which is most hemorrhagic strokes. So it used to be called a grand mal seizure. That's your widowmaker, or the more commonly used for a massive heart attack. The widowmaker, the certain blood vessel in the coronary artery. Basically that's more common in men. Obviously it happens to everyone, man, woman and NB. So that's your major fucking stroke. They're usually quite brain dead. Depending on what part of the brain, blah blah, of that nature. But the ischemic ones are the more common ones because of you're just old. Last day that I went to school with, not in the same year, not in the same grouping as me, essentially. So like I was 1C1 when I went into secondary school. First year, Group C, Part 1, blah, blah, blah. But they changed me. I got put in 2B2, and because I got moved out, they brought someone up from primary school who was meant to be going to a different secondary, and she went into this place that I had vacated. When she got to 6th year, I left in 5th year, so just roughly 5th year. So this lassie was 17 and she had a hemorrhagic stroke. Grim. So it can happen to it, just the blood clot forms somewhere for a variety of reasons. So imagine losing your eldest. She had younger brothers and sisters, two of them. But she had a stroke as a teenager. Fucking hell. The human body is oddly fragile and oddly resilient for many different reasons. Ugh. So the hemorrhagic ones are like 15%. Slightly different here, I think. It depends. Plus, more vascular issues are occurring because aging population, people my age and up, there's more of us older. Well, I'm not old. Am I old? I don't know if I'm old. I might be old. That thing snoring his head off through there calls me old. Take a frying pan to his face one day. But so strokes can happen to anyone. But imagine that stroke when you're that young.
On. To understand an ischemic stroke, let's start with the brain's blood supply. Here's an incredible cadaver dissection, and you're zoomed into the right side of the neck here. And if I reflect this muscle out of the way, called the sternocleidomastoid, you can see the carotid arteries. Here we have the common carotid artery, and this is what you'll feel when you're trying to feel a pulse on your neck. But the common carotid artery will branch into an external carotid artery and an internal carotid artery. The external carotid artery supplies the face with blood, but the internal carotid artery will go into the skull, and this is the major pipeline that delivers blood to the brain. And it will branch into smaller vessels like the middle cerebral artery, which we'll talk about in just a second. But inside the brain, these vessels will eventually become tiny capillaries, feeding oxygen to billions of neurons. During an ischemic stroke, something blocks one of these vessels, cutting off the blood flow. And the most common culprit? A blood clot. Either a thrombus, which forms right in the brain's arteries, or an embolus, which travels from somewhere else, like the heart. Imagine a highway, your blood vessel in this example, blocked by a massive traffic jam, stopping most blood and oxygen flow. The brain tissue in the core of the blockage dies quickly, within minutes. But surrounding this core is the ischemic penumbra, where blood flow is reduced but not completely gone, like a slow-moving lane. This tissue is at risk, struggling to function, but it can still be saved if blood flow is restored within hours, typically 4.5 to 6 hours, but sometimes even up to 24. And this is why we don't just give up if someone doesn't get to the ER in 4 to 6 minutes. We still have this salvageable brain tissue, the ischemic penumbra. And the faster we can restore full blood flow to the penumbra, the more we can reduce long-term disability. And as a side note, how many of you tried to say penumbra while watching this? If you haven't, go ahead, because it's kind of fun to say.
Penumbra.
But the middle cerebral artery, which is a branch of the internal carotid artery, is the most commonly blocked artery during an ischemic stroke. And this artery supplies large areas of the cerebral cortex that are responsible for motor function, sensation, and language. And so this explains some of the common stroke symptoms that you may have heard about, such as weakness or paralysis on one side of the body, trouble speaking, diminished sensation, and loss of vision. But there are other arteries that could be potentially blocked and cause other or additional symptoms. And a skilled clinician who has a good understanding of neuroanatomy and knows which arteries supply specific parts of the brain could actually get a pretty good idea of which artery is blocked just based on symptoms. But imaging is definitely going to be done in the hospital to confirm the exact location. You know, with the pace that medical technology is moving these days, it's kind of mind-blowing. We're seeing innovations that would have sounded like sci-fi just a decade ago. Take strokes, for example. something that affects nearly 800,000 people every year in the US alone. The conversation around recovery and neurotechnology has never been more important or more fascinating. Like, have you ever heard of this story? A stroke survivor speaks again with the help of an experimental brain-computer implant. One source highlights how this implant is giving a woman her voice back after 18 years of silence, while another dives into the AI powering the tech. As someone who's passionate about health and science, I love that I can read diverse perspectives all in one place to get insights on this new groundbreaking technology. This is all thanks to Ground News, which is an app and website that pulls sources from around the world so you can get more context on the news that you read. For this story, you can see over 250 sources are covering this breakthrough. In the world of health, it's crucial staying informed with accurate information. Misleading medical news spreads like wildfire, creating confusion and false hope. That's why I'm proud to partner with Ground News. They help you cut through the noise and verify the credibility of every source, especially when it comes to science reporting. Think of it as an anatomical dissection of the news. Precise, thorough, and built for people who want to understand, not just react. Here you can see that 98% of the outlets covering this story are rated high to very high for reliability, which is super reassuring when we're talking about breakthroughs that could impact people's lives. Plus, Ground News has a dedicated health and science page, so you can stay up to date on the latest developments in stroke recovery, medical tech, and beyond. So if you're interested, go to Ground News and subscribe by scanning the QR code on screen, or head to ground.news/human to get 40% off the Vantage plan, which gives you unlimited access for just $5 a month. That link is also in the description below. And now, let's get back to strokes. So what causes the blood clots that lead to a stroke? Well, a major culprit is atherosclerosis, which is plaque buildup in arteries, like the carotid or cerebral arteries in this case. Plaque made of cholesterol, fat, and calcium narrows the vessels, creating turbulent blood flow. But this plaque can rupture, which then triggers the formation of clots. You could kind of think of plaque as rust building up inside a pipe, narrowing it and making water flow unevenly. If that rust breaks free, it can cause debris to clump, blocking the pipe or the artery entirely. And there are definitely some things that we can do to reduce our risk of plaque buildup that we're going to discuss a little bit later on. But I do need to mention the clot that forms somewhere else and travels to the brain. And remember, this traveling clot was called an embolus. But let's say someone has irregular heart rhythms, like atrial fibrillation, where the heart's upper chambers quiver instead of pumping properly. This allows blood to pool in the chamber, and stagnant pooling blood will start to form clots. And so a clot could break loose from the atrium and travel to the brain. And as an FYI, this is why some people with AFib take blood thinners in order to help prevent strokes. But how do you know if someone's having a stroke? Well, we have definitely illustrated that time is critical, so we use the acronym FAST. F stands for face, and so you'd want to ask them to smile and see if one side is drooping. A is for arms. Can they raise both arms up, or is one drifting down? S is for speech. Ask them to repeat a simple phrase. Is their speech slurred, or is it strange? And T is for time. If you see any of these, call 911 immediately. Other symptoms might include sudden confusion, dizziness, or even severe headache. And again, the faster one acts, the better the chance to save as much brain tissue as possible. So how is an ischemic stroke treated, at least during the acute phase? Well, it's probably not going to surprise you that the goal is to restore blood flow as soon as possible. One treatment is a clot-busting drug called tissue plasminogen activator, which can dissolve the clot if given within 3 to 4.5 hours of symptom onset. But timing is obviously tight, and not everyone is eligible for this type of treatment. And it can also increase bleeding risk. So this is definitely not something that is going to be given with a hemorrhagic stroke. Another option is a mechanical thrombectomy, where a surgeon threads a catheter through an artery, often from the groin, to physically remove the clot. And in some cases, this can work up to 24 hours after symptoms start. And it's pretty incredible that we have this kind of technology to complete a procedure like this, like literally threading through something through the arteries to bust up a clot. It's pretty remarkable. Now, let's touch on hemorrhagic strokes real quick. Instead of a blockage, these happen when a blood vessel bursts, leaking blood into the brain or surrounding tissues. This can be caused by high blood pressure, aneurysms, or even head trauma. The bleeding compresses brain tissue, causing damage, and it's tougher to treat, often requiring surgery to stop the bleed. While they are less common, they're also more likely to be fatal. So controlling something like high blood pressure is key to prevention. And so let's continue down this road of prevention and discussing what you can do to reduce your risk of having a stroke. Again, you want to keep your blood pressure in check. Aim for getting below 120/80. So if we're talking both numbers, you want below 120 and below 80. High blood pressure is the #1 risk factor for both stroke types because it can weaken the arteries, which can lead to bulges in the arteries called aneurysms, and then these could burst, leading to a hemorrhagic stroke, and it can also lead to plaque formation, leading to an ischemic stroke. Obviously, eating a healthy diet is always something that we talk about with cardiovascular health because this can help to control cholesterol and reduce the risk of plaque formation. And of course, exercise is wonderful for cardiovascular health. I love showing my students the elasticity of this aorta because I use it to discuss that when arteries are nice and compliant, meaning they stretch and recoil, this recoiling helps push the blood further downstream, making it easier on the heart and even reduces blood pressure. And exercise can help maintain healthy, compliant, stretchy arteries and also reduce your risk of plaque formation. If you smoke, it would be ideal to quit because it's a massive risk factor for clot formation. And manage your blood glucose levels because those with elevated blood glucose or blood sugar levels or even diabetes, that excess blood glucose can irritate the inside lining of the blood vessels, making it more likely for, here it comes again, plaque formation.
You know, it's in a theme there. Oh my God. Oh, I can't. Oh my God. Do you want to know what the most common one is for the cause of a migraine? Dehydration. Ha! Stay hydrated. Alcohol and other toxins dry out. It makes you use all your water up essentially. It's usually either under pressure or because your blood's a lot thicker because there's not enough H2 other plasma stuff. It's just a tightening, or it's blocked. It's too much blood. It's not a thrombus or an embolus. It's right there. It's usually behind the eyes or up here on the forehead. That's why I keep on saying stay hydrated. Now, Super Hubby has to stay hydrated because he's on allopurinol. It's a chemical flush because his kidneys are not efficient, let's put it that way. Oh, fuck it. If people are too squeamish, just say and I'll stop this one, okay? Because, yeah, the human weird, like we're odd and we do things and things get stuck in places, things that we put into ourselves, perfectly normal things, and they can seriously, the things found in that, well, not this particular body, but things found in the human body just
It's not abnormal because it's small and deflated. It's abnormal for another reason. Now, this fissure here, or this crack, separates the lobes here. And for those of you who've maybe taken an anatomy class, you've already figured out what's abnormal about this right lung. Welcome to the lab, everyone. Today we're going to show you 5 crazy things we found in dead bodies. Or in other words, things we found that we didn't expect to find while doing anatomical dissection. You see, when we get a donated body, we don't get every little detail about their health history, like previous surgeries, previous trauma, or chronic conditions. We mostly just get age, gender, and cause of death. So that means any anatomical abnormality that wasn't related to their death, we wouldn't know about unless we explored the body through anatomical dissection. So let's take a look at those 5 things we found in the bodies here, from abnormal lungs, ovaries, to even what cancer can do to surrounding tissues. In other words, let's get ready for this abnormal anatomical awesomeness. So before we start, I want to say thank you to all those who donate their bodies to science. We could not educate students in the same way without these amazing anatomical gifts. And sometimes they give us more than we bargained for by showing us some cool anatomical abnormalities. And let's start with our first one, well, counting backwards at number 5 with the abnormal lung. So take a look at this lung here. This is a right lung. This is the back side of the lung, the lateral aspect or the side of the lung, and here's the anterior aspect of the lung. So if I held it up to me, it would essentially sit like so with the back side and the front here. Now, it's not abnormal because it's small and deflated. It's abnormal for another reason. Now, this fissure here, or this crack, separates the lobes here. And for those of you who've maybe taken an anatomy class, you've already figured out what's abnormal about this right lung. But if you haven't, let's jump over to the other body to show you a normal right lung. So here's our thoracic cavity, or our chest cavity dissection here. You can see the heart and its pericardial sac in all of its glory here. But let's take a look at the lungs here. Everybody always loves poking the lungs because they're nice and gushy and elastic and filled with air. Obviously, they're deflated. But this right lung, you can see, again, those divisions or these fissures or cracks here. Here's one lobe, a second lobe, and if I remove these out of the way, you can see a third lobe down where my pointer finger is wiggling at. Over here on the left side, you've got a left lung with one lobe here. If I remove that, down in there, you can see the second lobe. So hopefully seeing the normal right lung, that gave you a hint as to what's different about this one. This right lung is missing a lobe. It only has 1 and 2 lobes. Normally, right lungs have 3 lobes and left lungs have 2 lobes, but this one was an anatomical variant. Now, this person didn't have a lobectomy. We didn't see any surgical incisions when we did the exploring, and these lungs filled the entirety of the right side of the thoracic cavity. It's pretty crazy to think about that sometimes you can get a variation in lobe numbers from person to person. Now, what some of you may be wondering is, if it's missing a lobe, would that affect lung capacity?
Do you want me to go back to the beginning? I can go back to the beginning if you like me. No problem. So these are anatomic. So these must be things, not how we're odd, just how odd the body can be inherently. That's woo. Missing a lobe of the right lung. I wonder if they got out of breath easier than us. Wait. I'll go back to the beginning. Go back. Go back. Go back.
It's not abnormal because it's small and deflated. It's abnormal for another reason. Now, this fissure here, or this crack, separates the lobes here. And for those of you who've maybe taken an anatomy class, you've already figured out what's abnormal about this right lung. Welcome to the lab, everyone. Today we're going to show you 5 crazy things we found in dead bodies. Or in other words, things we found that we didn't expect to find while doing anatomical dissection. You see, when we get a donated body, we don't get every little detail about their health history, like previous surgeries, previous trauma, or chronic conditions. We mostly just get age, gender, and cause of death. So that means any anatomical abnormality that wasn't related to their death, we wouldn't know about unless we explored the body through anatomical dissection. So let's take a look at those 5 things we found in the bodies here, from abnormal lungs, ovaries, to even what cancer can do to surrounding tissues. In other words, let's get ready for this abnormal anatomical awesomeness. So before we start, I want to say thank you to all those who donate their bodies to science. We could not educate students in the same way without these amazing anatomical gifts. And sometimes they give us more than we bargained for by showing us some cool anatomical abnormalities. And let's start with our first one, well, counting backwards at number 5 with the abnormal lung. So take a look at this lung here. This is a right lung. This is the back side of the lung, the lateral aspect or the side of the lung, and here's the anterior aspect of the lung. So if I held it up to me, it would essentially sit like so with the back side and the front here. Now, it's not abnormal because it's small and deflated. It's abnormal for another reason. Now, this fissure here, or this crack, separates the lobes here. And for those of you who've maybe taken an anatomy class, you've already figured out what's abnormal about this right lung. But if you haven't, let's jump over to the other body to show you a normal right lung. So here's our thoracic cavity, or our chest cavity dissection here. You can see the heart and its pericardial sac in all of its glory here. But let's take a look at the lungs here. Everybody always loves poking the lungs because they're nice and gushy and elastic and filled with air. Obviously, they're deflated. But this right lung, you can see, again, those divisions or these fissures or cracks here. Here's one lobe, a second lobe, and if I remove these out of the way, you can see a third lobe down where my pointer finger is wiggling at. Over here on the left side, you've got a left lung with one lobe here. If I remove that, down in there you can see the second lobe. So hopefully seeing the normal right lung, that gave you a hint as to what's different about this one. This right lung is missing a lobe. It only has 1 and 2 lobes. Normally, right lungs have 3 lobes and left lungs have 2 lobes. But this one was an anatomical variant. Now, this person didn't have a lobectomy. We didn't see any surgical incisions when we did the exploring, and these lungs filled the entirety of the right side of the thoracic cavity. So it's pretty crazy to think about that sometimes you can get a variation in lobe numbers from person to person. Now, what some of you may be wondering is, if it's missing a lobe, would that affect lung capacity? And again, if this is how the person came and the lobe wasn't removed surgically, the answer is not so much. The important part is the tubing inside. So again, if we take a look at this abnormal lung here, you can see some of this tubing that I've exposed by removing some of the lung tissue from this lobe here. But that tubing that's going down and branching into the lung tissue, these start as bronchopulmonary buds, or little tiny buds of tubes while you're developing inside mom. And those tubes continue to grow and to develop, and as they're growing and developing, the lung tissue starts to wrap around these tubes, and certain fusions take place between the lung tissue and the various tubes, which starts dividing the lung into different lobes. Now, as long as the person has all the bronchopulmonary segments, or this tubing, going within the lobes that they have, they're going to have lung capacity that is sufficient. And they found variation in different cadaver labs. They've seen right lungs with 2 lobes and even 4 lobes in some cases.
Does the left lung? Yeah. Evolution. How we were formed. Yeah, the mammalia. This form. Yes, it took a debuff. It lost that so the heart could develop. It happened. It takes a lot for that to actually go into a species like showman or ape. Yeah, it took a debuff so that the heart could get, so there'd be space for the heart. That's why it's the second lobe of the left lung is it's longer. It inflates more. That's why you get checked in the back. They check your breathing, all that things. It took a debuff, and one got put down here. That's why assassins. It's the left lung and the heart that assassins used to go for with daggers. So third, 4th and 5th rib. You go right in there, you puncture the lung, you go right through the lower lobe, the back lobe, and you go straight into, depending on what rib you go through, or what angle you go in at, it's either going into the ventricle or the atria. So yeah, it took a debuff. That's how a lot of people got assassinated by getting stabbed on this side, the left side. Usually into the lobe at the back and straight into the heart. It's where we get stilettos from, by the way. That's why assassins used to carry stilettos, these two-sided dagger, and straight in through the ribs, and then through the lung, through the not smaller, the longer, but it inflates bigger, and straight into the heart. human body is, oh, you're welcome. So, right lung, 3 lobes, 4 lobes. These people get documented when it gets found out when they go in for medical checks and shit. 4 lobes. So yeah. That's why whenever Super Hubby hears it, what's the best way to a man's heart through the 4th and 5th rib? A bit dark. But yeah, so daggers straight in through that way. Quickest and easiest way, going through that way, through the front. Got all the ribs, you might hit the sternum, things like that. You might get the pulmonary artery, which if you get to a hospital quick enough, they can. Mind you, in saying that, you have to be literally minutes away from the hospital. If they get you, well, obviously you get stabbed in the heart, you're going. Made to show a sign of affection. Oh, he thinks of it. It's like, oh, that's a quick way to take someone out. Yeah. I'm married to a lunatic.
They found left lungs with even 3 lobes. And so those variations, again, as long as they have the proper bronchopulmonary segments or the proper tubing going into the variations in the lobes that they have, they should be okay. But again, most of us come with 3 on the right and 2 on the left. Number 4, the structure that we started to refer to as the stuck Achilles. For this one, let's look at a normal Achilles first, and then we'll go to the abnormal one. So as you can see, we're looking at the posterior aspect of the lower leg, or the back of the lower calf here, and we often refer to this as the calf muscle, but it's technically called the gastrocnemius muscle. And then you can see this amazing tendon called the Achilles tendon, technically the calcaneal tendon, but this is the largest and strongest tendon in the human body. And if we get close, you might be able to see a fiber orientation of these collagen fibers going in all the same direction, because this tendon is made of a dense regular connective tissue, which is really important to help it be strong in this one direction. Again, regular because the collagen fibers are aligned in these rows here. And when this muscle contracts, the tendon therefore pulls the heel upward. Now, look at how glossy this tendon is up at the musculotendinous junction here. You're not going to see that on the abnormal Achilles that we're going to show you. We're going to look up here and see a major difference on the abnormal one in just a second. So the abnormal Achilles is from the same body, just the different leg. And you can see it looks relatively normal from here to here. Even when we get up to that musculotendinous junction, you can see that nice distinction between the tendon and the muscle belly here. But if I rotate it towards you a little bit here, if you look closely, we're nice and glossy, and then it starts to change a little bit. And the tissue looks a little bit more frayed, and I always say goopy to people. And the muscle belly of the medial aspect of that calf muscle is scrunched upward more so than it normally would be. This is all scar tissue from a partially ruptured Achilles tendon. Now, one of the things that was also interesting about this is when I was dissecting this tissue, I have to reference this tissue here, this white tissue called fascia. Now, keep in mind this fascia would continue down like a sleeve over the muscle and the tendons here. And usually fascia, I can slide up underneath it relatively easily and gently peel it away from the muscle or the tendon. But in the case of right here where the tendon, the Achilles tendon was ruptured, it was totally fused with that scar tissue. So I want you to think about that. Fascia surrounds muscles, but the muscles still need to slide and glide underneath the fascia. In the case where this guy was ruptured here, the fascia and the tendon, or the scar tissue from that partial rupture, was fused together. Now think about what would happen every time the guy got up on his tippy toes. It would try to slide and glide, it would be stuck to the fascia, so it would yank on it. So likely this person when they were living had some tension and tightness going on there, and even probably some limited range of motion. Now most people, when they rupture their Achilles, they tend to do it lower down, which tends to be a little bit less of a complicated surgical procedure because you can stitch tendon and tendon together. When you rupture close to the musculotendinous junction, that can be a little bit more of a complex surgical procedure. But in the case of this particular person, likely didn't have surgery because, again, a partial rupture, but it healed with all that excessive scar tissue. And number 3,
the mutant ovary. Now, in order to see this abnormal ovary, we've cut a body in the sagittal plane, or in other words, divided it into right and left sides. One side's going to have the normal ovary, the other's going to have the abnormal. Let's take a look at the normal ovary first here. Again, you can see that sagittal cut. Here's the frame of reference for the spine, or the lower part of the spine. Here's the pubic bone, and we're looking inside the pelvic cavity here. Here's the uterus, and close by we can see the structure that we call the ovary, and I'll set it down so you can see its relationship and its size here. About the size of an almond. So not a huge structure, and we know the ovaries produce eggs, or in other words called ova, also release estrogen and progesterone. But what about the abnormal ovary here? So let's take a look at the other side. Again, this sagittal cut, you can see the spine, pubic bone for a frame of reference, and again the uterus. But oh my goodness, look at the size of this ovary. It's like quadrupled in size compared to the normal ovary here, and potentially this could be something from PCOS is what we theorize, polycystic ovarian syndrome, where the ovary develops all these cysts and enlarges. This particular body also died of breast cancer. Now, there's mixed data or mixed literature that says PCOS can be a risk factor of breast cancer, and other studies say not so much, but it's something to think about. Now, it's crazy to think of the size difference here again and the potential pain that this could cause. So again, women, you are troopers. We love you and you're awesome. I mean, guys, could you imagine what would happen?
They'd find me weird. 0 ovaries. 0. None. Minuscule, underdeveloped uterus, and barely, hardly any endometrial line, the lining of the womb essentially, where the egg, the fertilized egg, the ova attaches to help it to grow baby, potentially. So 0 ovaries. Stunted, malformed fallopians, and so I might be an anomaly.
And if one of our testes quadrupled in size, we would probably die just from the emotional distress alone. Number 2, the confused heart. Now, why would we refer to a heart as being confused? Well, that's probably because the heart forgot how to beat properly, or in other words, there was a problem with the conduction or the electrical system of the heart. And every once in a while, we'll open up cadavers where they have a pacemaker. And on this particular heart, you can see the wire. The wire is often referred to as the lead of the pacemaker system. And if I get closely, you can really see how that wire is going into the right ventricular chamber, and it attaches to the heart wall, or in other words, the heart muscle. So when it gets an electrical impulse from the pulse generator that's typically implanted in the chest, it can control rate and rhythm more properly for those who have had issues with the conduction system of the heart. Now, one other thing I want to mention about the pacemaker system is that the heart of the pacemaker, pun totally intended, is again that generator which has the battery and creates the stimulus that goes down through the lead and therefore makes the heart contract. Now, it would make a lot of sense to place that generator in a more superficial position if, say, like the battery ever died or we needed to replace that generator. It's a much less intensive procedure or less complicated than having to replace the lead that's connected to the heart. So definitely we want to get this right and leave that in relatively permanently. But if we had to ever replace the generator of the pacemaker, that would be a much less intensive surgical procedure. And number 1, cancer and the wimpy greater omentum. Now, what's a greater omentum? Well, funny you should ask, because we're going to take a look at this in the abdominal cavity here. Now, a lot of times when we think of the abdominal cavity, we think of the guts or the small intestine that you can see in my hand here. But you would actually see this apron-like structure draping over the small intestine, and this is called the greater omentum. Now, it's not attached inferiorly, it's actually just attached up to the stomach and the transverse colon, so you can actually reflect it away and then bring it back down. When we first opened up this cadaver, the first thought I had was, wow, this thing is so thin comparatively to other greater augmenta that I've seen in the past, and it's also shifted over to the left side. Now to really appreciate that, let's show you a normal looking one. Now here you can see the abdominal cavity of another cadaver. Just to orient you, this would be your six-pack muscle underneath this white tissue here, so you reflect the muscle away, and that's the first thing you would see is that greater omentum. And you can see this one is a lot thicker, does a better job of covering the majority of the small intestine here. And what's cool about the greater omentum, as you can see from that yellow tissue, it is a place of energy storage because it's made of adipose tissue. It also has lymph nodes, so it provides some immune function. And one really cool thing is it actually will migrate. Remember, it's not attached down here, so there's some freedom of movement for this structure, but it can migrate to areas of infection or even areas of trauma. So let's give an example. Let's say this little structure here called the appendix ruptured. They have seen cases where the omentum will migrate around that a little bit and shift over to there and encapsulate that infection in hopes to essentially stop it from spreading to other areas throughout the abdominal cavity. So back to this abnormal or the wimpy greater omentum that had been thinned out. This particular body died of colorectal cancer that metastasized to the liver. You can actually see some of those nodules or those areas where the liver is unhealthy here. And that's eventually what unfortunately caused this person to pass away.
Yeah, it
But
did.
in regards to the greater omentum, with the cancerous nodules in the colon and the rectum here, the idea is it possibly shifted the omentum over to that side. And oftentimes when people are on chemotherapy and drugs of that nature, it can cause a lot of weight loss. So that might have also pulled some of the adipose from this. And there's a theory that possibly even the cancer cells maybe have used it for an energy source. Thanks for joining us on this tour of 5 crazy things we found in the human body. Go ahead and comment below if you've heard of any crazy things that people have found in human bodies, or just future ideas that you guys have for videos that you want us to create. Also, you can see we've got some cool anatomical artwork. We'll put that in the link description. It really helps support our channel. Please smash that like button and subscribe if you feel the need. We'll see you in the next video.
See? Human body. Funny. And yeah, it can move around. Ooh. Ah. I know what we can go into next. Do 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 do. Do 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 do. Do 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 do. See what I can find. Yeah. Slideshow. Slideshow? There we go.
People have high levels of this mysterious third cholesterol, leading to an untold number of deaths. So let's talk about cholesterol, the good, the bad, and the ugly.
Aging population, especially up here in Scotland, in UK in general. So the doctors get told this anyway. That's why they're doctors. Yeah, the third one's very, very bad. There's genetic factor into cholesterol distribution within the human body, by the way. Depends on your genetics. Who'd have thunk it? Genetics is fascinating. They are testing that now. Minds is getting checked for all three types. Uncle, one of twins. One twin, yes. Other twin, no. The younger twin is the one that the problem. Predisposed. I can't speak honestly. Predisposed to more of the two, like the kind of bad and the very bad types of cholesterol. He's had heart surgery, 4 of them. Poor uncle. This is my mum's younger brothers. They're both under 70, for fuck's sake. So he's had heart surgery. My auntie worries for him, obviously. Last time I went up to Perth to see my family, I was talking to her. Yeah, genetic, yeah. Like I said, genetics, fucking fascinating. I didn't go into genetics. You need to be really good with maths, higher math, calculus, blah, 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 blah. Because that side, you need to be able to do that properly. I understand the genetics and how it gets formed in people. Once the genetics have been set in the person, I can understand it and I can say, all right, we've seen this, people with this allele or this gene and blah, 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 and they might get blah, 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 or might be predisposed to blah, blah, blah thing. So whenever you see the headline, found the gene for blah blah blah, you know there's lots of different things at play there, by the way, so don't believe that bollocks. Go to your nearest trained medical professional. That's why they went to uni. That's why I went to uni, to study viruses and parasites, because they fascinate me and how they fuck us up.
First, I want to say a few words in defense of our villainized friend. Justice for cholesterol. It isn't all bad for you. Sometimes it just gets a bad rap. Your body makes it because it does some pretty important stuff, like helping make your cell membranes and hormones, so we can't just get rid of it entirely. But it is complicated because there's more than one kind of cholesterol. In fact, there's more than just good and bad cholesterol. And while they got those nicknames for legitimate reasons, they're also not so black and white. So let's just start at the beginning. Cholesterol is a molecule that travels through your blood attached to lipoproteins. These protein and fat combo molecules carry fat to the parts of the body that need it. Because yes, fat is also needed in moderation. So your protein and cholesterol duos travel all over the body, but they take a few different forms.
That momentum we just saw, da-da, and other things. around the body. Yeah, don't villainize cholesterol. It's got a purpose. It wouldn't be in us if it wasn't there for a reason. Obviously, the fine things in the human body that are not there for they're there, but they're for no fucking reason, and the organs that are not just other odd things they have found in us that have formed when we were inside mum. Or person, or individual. Proud of it. Rejoice, comrades. It's the Morton is here. Hi, Morton. I went for a cardiac stress test yesterday. My joints hate me now. So now we're learning about cholesterol. Because they're checking that. I will find out in 10 to 14 days. Business day. Forget, lop off the weekends. So next week, following week, maybe the next week after. So in about roughly 3 weeks' time. Unless it's an emergency, the lab doesn't do these sort of things. It's just a general blood test and cholesterol, blah blah blah. So I'll find out in 3 weeks, roughly. Yeah. Might even find out in 2 weeks, which will be the 10 days. And when I know my results, I will tell you all, and I'll describe to you if it's bad or good. I'm hoping it'll be okay.
Like low-density lipoprotein, or LDL cholesterol, has more cholesterol per protein, and high-density lipoprotein, or HDL cholesterol, has less cholesterol per protein. And these two forms of cholesterol can be thought of as opposing forces. It comes down to the effects they have on your body. See, when you have too much LDL cholesterol floating around, it tends to stick to the walls of your blood vessels instead of flowing through like it's supposed to. This buildup is called plaque. It's not the stuff that builds up on your teeth, but it accumulates in a similar way until there's a big problem. As more and more plaque builds up on the sides of your arteries, the passageway for blood gets smaller and smaller. Eventually, a plaque can block the flow through your blood vessels, and a clot like that can end up giving you a stroke or heart attack. So LDL's nickname, bad cholesterol, is probably starting to make some sense right now. But HDL cholesterol works in a totally different way. While too many LDLs build up in a plaquey plug, keeping your blood from flowing around your body, HDLs work to clear up that problem. HDLs can remove LDLs from your bloodstream and bring them to the liver where they're broken down. And that's why HDL is known as good cholesterol. It's had that street cred since 1977, when a famous study found that more HDL was associated with less heart disease. And that's still true, kind of.
Fun fact. The gallbladder is involved in this process, so I might have higher cholesterol because of that, because I got my gallbladder removed. The problem with the gallbladder, it fills up with fucking stones like a bastard. And the hepatic bile duct, which connects to this, the gallbladder is underneath and to the side of the liver. So it's a keyhole surgery, snip, snip, take it out. Then they go and do pathology, which is basically just testing the thing, checking it, see what it is like. So, they took mines out, fucking filled with stones apparently, and the bile duct. So that gets cut as well, because obviously the gallbladder isn't doing its fucking job anymore, creating the bile. And when the best way I can describe what it does is if you've went out and drunk far too much of anything, and your body thinks, fuck, poisoned, and you start throwing up, and after it's expelled everything, including stuff from your intestines, sometimes, it's a toss-up, depends on the person. After it's expelled everything, usually through the mouth, When you throw up and you're no longer bringing up anything of substance, and you see this yellowy, greeny liquid that you're bringing up, that's bile coming from the gallbladder, because your body is desperately trying to expel what it thinks is a poison, which alcohol technically is. So that's came from, it's entered, it's left the gallbladder through the bile duct and went through into the intestines, lower stomach, and up through your esophagus. Bile, when you throw it, after you've been throwing up everything, you've got rid of everything and you're throwing it up, that is a corrosive effect, because it's the pH of this stuff is fucking mental. It's literally, I don't like using this word for things of this nature. It's literally trying to dissolve anything it comes in contact with, because that's what it fucking does. It breaks everything down so the liver can deal with it. And oh, we might still need this part, this thing, this molecule, and it gets put into the bloodstream to go wherever it's needed. But if you've done yourself in quite badly with alcohol, people have done that as well. They've bulimics and anorexics, they've done that to themselves, and their esophagus, their food pipe, their intake pipe has been so scarred it is literally just sheath thin, because they've literally just been throwing up bile and stomach acid. Ugh. That's hydrochloric acid, by the way, that you're bringing up. Ugh. I've done that to myself. Probably had alcohol poisoning about 3 or 4 times in my life because I've been a fucking idiot. Don't drink too much so you're going to throw up bile and bloody stomach acid. You're doing serious damage to your food pipe. And to your stomach. And to your lower intestines as well, actually. But some people have it the other way. It goes down where, well, you can imagine. And if at that point you're finished expelling everything down in that way, down the GI tract, it scars the it doesn't do as much damage because it's used to dealing with it. Your intestines are used to it, and your bowel when you go to the toilet. But it's still scarring parts of you and stuff on the way out down that route. The worst one is throwing it up, bring it all the way back up from the middle or lower GI tract. Ugh. It's horrible.
Kind of. The concept of good cholesterol is a bit more nuanced than bad cholesterol. A 2017 study in Copenhagen found that you really want a certain amount of HDL, around 60 milligrams per deciliter, to benefit from it. If you have too much more than that, your risk for heart disease goes back up. And a recent study in the US found that if you have less than that, it's only associated with a greater risk of heart disease for some people. So overall, we can say that LDL is bad cholesterol and HDL is good cholesterol, with some important caveats. But when your doctor reads out your numbers with that disapproving look, they're often not even
the bile as well, but the ones that the stuff that strips the enamel off the nashers, that's the stomach acid, because it is strong as fuck. They've done tests on me because there's like, I'm assuming you've all heard of NSAIDs, like anti-inflammatory drugs. Like these are prescribed ones that I got put on when I was a lassie, when I got diagnosed with my arthritis when I was 11. Because because I was on these from such a young age, and my body didn't know how to deal with it. When they found Chris, I woke up screaming one night, absolute fucking agony. He was panicking. He wasn't panicking, he was fucking ill. Called an ambulance, rushed me in, and I was screaming all the way there. They were so fucking ill. They thought a peptic ulcer, an ulcer had burst in my stomach or my intestine. And when they checked me, they found that the lower sphincter, where things empty out of the stomach. There was a massive sort of an internal boil, if you wish, and they had to break it open to see what the fuck's caused this, and they found crystals of one of the earliest NSAIDs that I'd been put on when I was 12. And it sat there, and this was when I was in my 30s. Late 20s, 28, I was 28, so it'd been forming, and it'd been sitting in there for whatever, and part of the lower part of this sort of internal boil thing, it broke, and the stomach acid flooded into it, and lots of other things that are in the stomach to dissolve the food. And that's why I was in screaming agony, so they thought it was a peptic ulcer, which gets caused with the alcoholics and stuff. So they said it can't be alcoholism that's done that to that lassie, and they found crystals of diclofenac and indomethacin in my stomach when I was 28. That's why I'm on omeprazole. To prevent that stuff from happening, it's the proton pump inhibitor. It stops the overproduction of the pepsins in the stomach and controls the amount of acid my stomach produces. They can't change the pH of it because that gets set when you're getting made. And they tested how strong my stomach acid was. Obviously, they had to take that out. They took out all the crystals, or most of them. Some of them were actually literally embedded into the stomach wall. They said, we're not cutting open this lassie just to remove that. So they just left it sitting there. And I'm on a high milligram omeprazole until I... Yeah. Seriously, my body is fucked.
Considering the other kind of cholesterol, which is bad, and let's just say we haven't found many caveats for that. I'm talking about a type of LDL called lipoprotein A, or LPA for short. We don't even know exactly what LPAs are supposed to do in our bodies, even though they separately evolved twice over 40 million years, so they probably do something. What we do know is that too much LPA can carry an even higher risk for heart issues than regular LDL. Which is weird because LPAs carry less cholesterol on average than other LDLs. It turns out that these LPAs can be dangerous all on their own without the extra cholesterol because of their size.
Rejoice, comrades! John the Brazen is here. Hi, John. Oh, fuck. Oh! Haha, come and get me. Seriously, what the fuck did they think was going to happen? Idiots. Peter Kyle, you're a fucking moron. But we already knew that. Or done deliberately. And are they still talking about banning VPNs? Good luck with that. Even if it wasn't against settled British law, I don't think the companies who actually control most of the VPNs of the world are going to let you. They'll just start funding fucking Farage and his merry band of lunatics. And I don't want that to happen, so don't say you're going to fucking ban VPNs, you fucking idiots. Yeah. Yeah. They shut up quickly about that, didn't they? And now they've just picked it up. Already been tried, you fucking idiots, and it's a sort of version of it. Stupid. I wonder how many people are using actual UK internet. I love Japan, it's on my bucket list. Oh my god. He didn't check. He went to bed early. He would not be happy. Fuck him. I will let this play. I'll still be in the room.
And shape. See, they can be pretty small, so they pass into the inner lining of your blood vessels. When too much builds up, you can get some nasty blood clots. LPAs can pull off this unfortunate trick because they look a lot like a molecule that helps break down clots in your blood vessels. But they don't do the whole breaking down clots thing. So when there are lots of LPAs around, it gets in the way of your body's clot removal systems. But the most awful thing about them is the extra protein they have called apolipoprotein A, or ApoA. And that ApoA protein sticks to types of molecules that cause big time inflammation. So when LPAs get into the walls of your blood vessels, plaque starts to build up in the inner lining, and LPAs destabilize the plaque. At that point, it's more likely to come off the artery wall and completely cut off blood flow. And that's when heart attacks and strokes happen. All of this kind of makes you wonder why you've never heard about LPAs and why your doctor doesn't check for them. I mean, come on, we've known about LPA since the 60s, but it's still not on the standard test for cholesterol? Well, even though it's seriously risky to have a lot of LPA floating around your body, and about 20% of the world does, it just doesn't have the same A-list publicity as HDL and LDL. And maybe that's because we don't exactly have a solution for the LPA problem right now. And don't get me wrong, we're not completely stumped. We're in phase 3 clinical trials for RNA interference drugs that seem to significantly reduce LPAs in your body. This type of treatment reversibly turns off the gene that tells your body to make ApoA. Basically, it adds in new genetic code that facilitates the breakdown of the protein's code, so you make fewer particles of the ugly cholesterol. And if these trials keep going well, we might have an effective treatment soon. As for your other cholesterol problems, there are concrete steps you can take to keep yourself healthy. As with most health-related topics, what you do to manage your levels may be different from someone else, because cholesterol can work differently depending on your genetics, your general health, and many other factors. But pretty much every study agrees that high LDL is bad, so ideally you want to try to keep that down however you can. Eating food with high amounts of saturated or trans fat can dangerously raise your LDL cholesterol. They seem to disrupt the process of breaking down cholesterol and fat in your body, and they also activate the pathway that makes cholesterol. So avoiding fatty meals and fast food can help get your LDL levels down. Also, exercising can increase your HDL cholesterol, but not to dangerously high levels. So you get a lower risk for cardiovascular disease when you move your body in healthy ways. Some people also find that medications called statins help manage cholesterol levels. Statins slow your liver's role in making cholesterol in the first place by limiting an important enzyme in the process. So if cholesterol seems a little complicated, that's because it is. Experts are still learning about how different kinds of it contribute to your health, especially now that we realize it doesn't work the same way for everybody. But at least now you know there's more than just good cholesterol and bad cholesterol, even if the third kind is pretty bad too.
Haha. didn't. Excuse me. It's a rollover. We bought a ticket for the EuroMillions. Didn't win. It's a rollover. 157 million on Friday. Don't buy a ticket. I'm going to win. Oh well. I wonder if we've won anything though. That'd be fun. Oh wait. Ooh. You can go there. Da 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 da. What are we? I will show you what happened to me and why I'm in this group now. Oh. Is this medicine maybe? Spiritual therapy.
A pulmonary embolism is a life-threatening condition that occurs when a blood clot travels to the lungs, blocking one or more pulmonary arteries. This obstruction restricts blood flow to the lung tissues, compromising oxygenation and potentially leading to fatal consequences, which is what we're going to discuss in this video. So keep watching to learn more. A pulmonary embolism is a sudden blockage in one of the pulmonary arteries in the lungs. It is most commonly caused by blood clots that travel to the lungs from the legs, a condition known as deep vein thrombosis. When the clot reaches the lungs, it can block the flow of blood, leading to damage or destruction of lung tissue. This is considered a medical emergency and requires prompt treatment. Factors like prolonged immobility, surgery, certain medical conditions, and genetic factors can increase the risk of developing a pulmonary embolism. Now let's talk about its potential to become fatal. The time frame for a pulmonary embolism to become fatal varies widely based on its size, location, and the individual's health. While small clots might resolve without harm, larger ones can be fatal within minutes to hours. Therefore, immediate medical attention is crucial, as prompt treatment
The reason I'm where I am is because there's two in Europe You're on one of them. The other one is Poland. They vanished from my VPN. I don't know why. The other two free ones, so there's 4 in the world: Netherlands, Poland, Japan, States, and I wasn't going to do that to myself.
And can significantly reduce mortality risk. A pulmonary embolism is potentially fatal because it involves a blockage in one or more of the pulmonary arteries in the lungs. This blockage, caused by a blood clot, interrupts blood flow to a portion of the lung tissue, depriving it of oxygen. The consequences of this interruption include impaired oxygenation. With reduced or blocked blood flow, the affected lung tissue cannot effectively participate in gas exchange. This can decrease the overall oxygen level in the blood, compromising vital organ functions. Lung tissue damage. The affected portion of the lung can become damaged due to a lack of blood flow. Strain on the heart. A pulmonary embolism increases resistance to blood flowing from the right side of the heart to the lungs. This added strain can lead to right-sided heart failure, known as cor pulmonale. Systemic impact. A significant drop in oxygen levels can affect other body systems, leading to organ failure or shock. And remember, the size and location of the clot, as well as the individual's overall health, influence the severity of the pulmonary embolism and its potential to be fatal, which is why immediate medical intervention is critical to improve outcomes and reduce mortality risk. Diagnosing a pulmonary embolism involves a combination of clinical assessment, imaging, and laboratory tests. Initially, doctors assess the patient's symptoms and medical history. D-dimer blood tests can indicate the presence of clot degradation products, but a negative result doesn't always rule out a pulmonary embolism. The most definitive diagnostic tool is a computed tomography pulmonary angiography, which is an imaging technique that visualizes the pulmonary arteries. A ventilation perfusion scan, which examines airflow and blood flow in the lungs, can also be used. In some cases, an ultrasound of the legs can help detect a deep vein thrombosis, which, as previously mentioned, may potentially lead to a pulmonary embolism. Pulmonary embolism is a serious condition, and recognizing its warning signs can be life-saving. Some of the primary warning signs include shortness of breath, chest pain, cough, rapid or irregular heartbeat, lightheadedness or dizziness, excessive sweating, clammy or bluish-colored skin, swelling in one leg, leg pain or tenderness, fever, wheezing, and feeling anxious or restless. A pulmonary embolism often presents as sudden and unexplained shortness of breath. This difficulty in breathing may be accompanied by sharp, stabbing chest pain that can intensify with deep inhalations, coughing, or even eating. However, it's important to note that not everyone with a pulmonary will exhibit all of these symptoms, and some might not show any symptoms at all. But if you or someone else is experiencing these signs, especially shortness of breath or chest pain, it's crucial to seek emergency medical attention immediately. Now, let's talk about how to prevent a pulmonary embolism. Preventing a pulmonary embolism often involves addressing its primary precursor, which is a deep vein thrombosis. Here are some of the primary steps. The first is to stay active. Regular movement, especially during long trips, can prevent blood from pooling in the legs. When flying or on long car rides, flex and extend your ankles periodically and take short walks when possible. Exercise regularly. Aerobic activities like walking, swimming, or cycling can help maintain good circulation. Stay hydrated. Drinking adequate fluids can help prevent blood from becoming too thick and prone to clotting. Avoid prolonged immobility. If you're bedridden or have limited movement due to surgery or another condition, your doctor may recommend exercises or frequent position changes. Compression stockings. These can help prevent swelling associated with DVT. They gently squeeze your legs, promoting blood flow. Elevate your legs. When resting or sleeping, elevating your legs can improve circulation. Medications. If you're at high risk for DVT or blood clots, your doctor might prescribe anticoagulants or blood thinners to prevent clots from forming, limit certain medications and hormone therapies. Birth control pills or hormone replacement therapy can increase blood clot risk. Discuss alternatives or risk management with your doctor. Stop smoking. Smoking affects blood circulation and increases the risk of DVT and blood clots. Maintain a healthy weight. Being overweight also increases the risk of DVT and blood clots. Regular checkups. Regularly consult with your physician, especially if you have conditions like cancer, heart disease, or inherited clotting disorders. Be aware during hospital stays. Hospitalized patients, especially those who have just undergone surgery, are at a higher risk. Ensure that the medical staff is taking measures to prevent DVT, such as providing blood thinners or pneumatic compression devices. Avoid sitting for long periods. If your job involves sitting for extended periods of time, stand up, stretch, and walk around periodically. By understanding the risk factors and adopting these preventative measures, you can significantly reduce your chances of developing a pulmonary embolism. But always consult with a healthcare professional about your personal risks and the best strategies for prevention. If you want to support the channel, please like and subscribe. I would greatly appreciate it. And there should be some other helpful videos popping up on your screen right about now that I think you will enjoy. Just a quick reminder, we are not doctors. This video is for informational purposes only. Thank you so much for watching. Have a blessed day. And as always, breathe easy, my friend.
Okay. I will explain by using myself as an example. HRT is a suspected cause or factor. There's no one definitive cause for these things, obviously. So HRT, and because I've been on it since I was 16 years old, because I can't produce the progesterone and estrogen that I need. My blood clots, the pulmonary embolism, that, well, it was just an embolus, formed in my right leg, so I have to wear the compression stocking below the knee on my right leg. It is sitting over there. I had to wear it today because I had to going down from appointment. So I had that on for, yeah, I took it off just before I started streaming. 13 hours. I have to wear it for a minimum of 4, and I've tried, I'm not meant to wear it for 24, you're not meant to keep it on for the 24 hours, because, me personally, because of my joint and bone issues. So, with the, right, 2 lobes, 3, I've got the 3 on the right. So I had 4 massive ones on the left lung, 1 right in the main junction going into the lungs. It was fucking massive. And one that had already migrated in, a little bit smaller than the largest one, and there was 2 smaller ones back up from that one. There was 2 on the right, and they were quite far into the lung itself, but they were smaller. So what they done, they had to give me injections straight into the side of me. 3 for the first 3 days, so 3 every day, so 4 hours apart. Got jabbed in my side for a stronger version of the pill I'm now taking, which is sitting over there. It's called Apixaban. Developed from snake venom, funny enough. Or designed, blah, blah. So they think that the HRT that I was on caused the clots, travelled up. Fucking massive one went straight, 2 smaller ones went into the left lung, and 1 large one which couldn't get through and blocked entry into the lung itself. My leg was fucking huge. And it was rigid, not quite table rigid, but rigid as it could go because of it. So now I'm going to be on there, pick up my bloods, they took bloods from me when I went into the surgery today, the practice, and it is still far too thick. The D-dimer came back okay, but the blood itself is just clogged with far too many platelets. So the apixaban will help deal with that, thin the blood down a bit. And I was literally out of breath. He kept on saying to me, he said, you're literally transparent. Because I'm usually, as you can tell, I'm very pale. I'm usually quite pale. Most days. But he said, I can see all the veins in your face. Fuck. So I wasn't getting enough oxygen, and that's why I've had to increase the amount of water I'm drinking quite drastically, actually. And I'm constantly moving, but I can't do the exercise parts of this because of my other health issues. I am currently still healing because I've fractured my right kneecap. And my middle sister, thought that was a factor as well as the HRT I was on. I'm allowed back on it. I'm not allowed back onto the pill form, which is equating more to the embolus issue. It's happening in a lot of people who are taking HRT. So trans femme, please be careful. And I'll need to get checked more times each year now because of it. I used to get, because of my other issues, I got checked either minimum of 2, but I'm getting like 3 now. It's been 3 checks a year for the last decade because of my other issues. So it's probably going to get stepped up to 4 a year, so every 3 months I'll be going in to see my GP or to the practice nurse, who is delightful. She is brilliant. So that's it. So it travelled up through the blood system, through the circulatory system, and went into the lungs. The 2 smaller ones on my right lung, they were probably one of the first ones that got destroyed because they were the smallest. And the one on the left lung was, causing all kinds of problems. I was hospitalised for 10 days in the respiratory ward, the lung ward, essentially. I was there for 10 days. I went in to see my GP thinking, oh my God, I've got water on the leg. I might need it drained or something. Or put on an injection of anti-inflammatories to get rid of the excess fluid, which I thought it was. No, it was because of the fucking emboli that were forming in my right leg. So I was used to my legs swelling up because of other reasons, autoimmune reasons, essentially. But no, massive fucking blood clots. I'm fucking cursed. Christ. Do. So, please be careful if you're on HRT. And it's DVT can happen to anyone. Long haul travel, air stewardesses and pilots, they're at risk as well because these get formed flying too much. A bit difficult to get adequate exercise in a flying metal tube. So a lot of them do actually develop DVT and pulmonary emboli. So embolus singular, so one, emboli one or more. 6 in my case, apparently. No, 7. 2 in, massive one, 2 preceding, 2 in the right. Yeah, 7. The ones that went into the left lung, one was fucking huge. The two that were already further into the blood vessels supplying the lungs, they were large, so they needed dealt with. Rejoice, comrades! Sozzled Snake is here. Hi, Sozzled. I am educating the masses about things that can go wrong when you're older. And we've just went through how a pulmonary emboli or embolus, blood clots that end up in the lungs, how they form, what the treatment is, ongoing care, blah blah blah. And I'm using myself as an example to show how it actually works and what the possible outcomes for patient. I can only give you my experience, obviously, because there's only me. If you suspect DVT or a pulmonary embolus or an embolus forming in your legs, usually they're right, oddly enough. It's a bit weird. Go and get it checked. See your doctor. I am not giving actual medical care here. I'm using myself as an example to show what can happen, or how it happens, or how it happened in this mess of a human. Oh, Christine will be going live in about 15 minutes. We started off with damn. Oh yeah, I went for an echocardiogram stress test. So I showed what that was like, what I'd done. My wrist still isn't feeling right because it held on running. They took bloods, blah blah blah, that sort of thing. Then general health check, diet, check my heart, listen to heart, listen to my lungs, things of that nature. So I'll get the blood tests back in 2 or 3 weeks. You can be assured I don't think I will reach 90. Did anyone? My gran, my mum's mum, reached 90. My other grandparents didn't. My dad didn't either, but the alcoholic, they died of pneumonia and liver complications. So my granny, who was born in 1921, she got to 93, 92. Yeah, that's right. 2013, yeah. All my other ones died when they were 80, 87, 87 and 89. My two my mum's dad died when I was born. 60, 64, 88 and 89 and 92. 93. I'll get this right. 93. I ain't going to reach 90. You never know. Watch this space. It's another 44 years. I don't know what to go on to next. Yes. Oh, don't you worry about me. Brilliant doctor, brilliant hematologist. She's fucking awesome. And For ease, I'll just call him a respiracist. So when a lung doctor, a pulmonary and cardiac doctor, he's giving me the sign off. He was fantastic. He was at my local hospital, which is not too much of a location giveaway, I think. Stop Hill. Near me. You can look up where Stop Hill is. It is a shiny new. No, it was shiny new. It's a cracking hospital. I love Stop Hill. And my next nearest one is obviously the main one for the city centre, not the city, Glasgow Royal. It's one of the oldest infirmaries in the UK, apparently. I love the Royal. When I got taken in because of these blood clots, because of these pulmonary embolus, I was in the old building, literally the old building. It really is quite old. And the lift scared the shit out of me because it is old as balls. I'll say old as balls. It was the lifts in the old building were done in the early 80s to mid 80s. So they're getting on for about 40 years old. I'm trying to think of what to go into next. Oh. We may as well go with the big one. Heart attack. Ah! My sister, the community nurse, has been in Wishaw Hospital a couple of years ago now. She got sent down there because they screamed, "We need fucking nurses." You can guess it was during the pandemic. And she lived with our other sister and commuted from where my middle sister lives to Wishaw Hospital. She said to him once she got back up the road to Perth, "I am never doing that again. The drivers in Glasgow are fucking bastards." My sister-in-law says the same thing. She lives here with my sister. Said, I can see why you don't drive. I moved down to Clydebank. The fucking lunatics on roads out there. And the roads in Clydebank fucking just end me. So glad I don't drive. I moved down. I managed to stay driving to get to my work in the city centre on the Broomhill Law. I gave up after 6 months. Fuck this, not doing it. Sold my Micra, said fuck off, no doing it. Bus for me or train. Couldn't do it. Too many fucking lunatics. Seriously, I don't know how people can drive in Glasgow at times. Too many nutters. Or too rage-filled. Do. One from the NHS longer than just a few minutes. Do. Do. Yeah. Yeah, I'll go to the Ted Ed one. Why not? I've been to that one. I know that one. People, please avoid Shots. I'm sorry, Shots. I'm sure some of the people who live there are delightful people. Perfectly sane, but fucking hell. See, we can blame her. Bloody Shot. Ugh. Do 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 do. Heart attack. Ted. Go. Oh. Seconds. Go.
Approximately 7 million people around the world die from heart attacks every year. And cardiovascular disease, which causes heart attacks and other problems like strokes, is the world's leading killer. So what causes a heart attack? Like all muscles, the heart needs oxygen, and during a heart attack, it can't get enough. Fatty deposits, or plaques, develop on the walls of our coronary arteries. Those are the vessels that supply oxygenated blood to the heart. These plaques grow as we age, sometimes getting chunky, hardened, or inflamed. Eventually, the plaques can turn into blockages. If one of the plaques ruptures or cracks, a blood clot will form around it in minutes, and a partially closed artery can become completely blocked. Blood flow is cut off to the cardiac muscle, and the oxygen-starved cells start to die within several minutes. This is a myocardial infarction, or heart attack. Things can rapidly deteriorate in the absence of treatment. The injured muscle may not.
They're literally breaking or snapping, bump, like small twigs, break. They're more like boom, 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 boom. It's a cascade effect, essentially. It's really. I wonder, have any of you heard of the golden hour? Yeah, if you manage to get to the patient, find them, get them to the hospital within that hour, they can fix, they can recover, they can repair what things have went in the heart with the cardiac muscle and the cardiac blood vessels. They can get repaired. But anything past that, then you're looking at cell death, blah blah blah, all that. Yeah. Just ask the 7 million people it takes out each year. To make it more interesting, instead of just dihydrogen oxide, I put in lemon. It's another thing that I need to do, drink lots and lots and lots of water. Look at that heart with arms and legs. That looks funny. Cool.
Be able to pump blood as well, and its rhythm might be thrown off. In the worst case scenario, a heart attack can cause sudden death. And how do you know that someone is having a heart attack? The most common symptom is chest pain caused by the oxygen-deprived heart muscle. Patients describe it as crushing or vice-like. It can radiate to the left arm, jaw, back, or abdomen. But it's not always as sudden and dramatic as it is in the movies. Some people experience nausea or shortness of breath. Symptoms may be less prominent in women and the elderly. For them, weakness and tiredness may be the main signal. And so
Oh, phew. All the people that I know of, family and friends, who have had heart attack, like major ones. They've all been. One of them was a lassie that my mum knew. She was in college. Mum delivered her child, then she went to college to become like an accountant, I think. And she was 29 and she had a heart attack. Just one of those weird. She was quite healthy. She liked to go out for a drink every now and again. Not often, obviously, but she'd just go out with her friends, celebrate stuff like that. Huge heart attack. They managed to get her back as well. Don't worry. She's an accountant now. She lives up in Aberdeen. Yeah, that fucking. That rumbling you're hearing, that isn't hunger. Signs of hunger: pale, you're kind of shaky, and your pulse is kind of weak, not as strong as it should be. Try to avoid using your thumb because there's a strong pulse in your thumb. So down from the left thumb. This is only because my mum taught us, and now my sister. Obviously, it's her job. So you go, our thumb's left, down that way. Go down from your left thumb down to here on your wrist, and down to either halfway down your thumb or a little bit more, and you go there with these three fingers. Da 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 da. Or you check, where is it? Lost it. Ah, there we go, got it. There's one on each side. There we go. So down from your right ear, down to right here, roughly. And I got taught this because my husband is 9 years older than me. My mum was worried and she taught me what to look out for with him. He's got an electrical imbalance in his heart, so there's not much we can do about it. Just doesn't matter. The oxygenated blood that leaves his heart through the aorta goes round the body, blah 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 blah. It's got an electrical imbalance in it, so I have to look out for signs for him, and my mum's told me what they have to look out for. But one of them is he's going to have to tell me. Doesn't he tell me half the shit I should know? Stupid bastard. We all should be taught this in school. Yes. Scottish Government, can you hear me? We should all be taught this in school up till you leave it either, well, you teach 16, you should be taught it in 1 through 4th year. Or if you're going to make them stay on till 18, when they're 17 and 18 and stuff, it should be taught in school. My nephews have been told now by my mum that, oh, Granny, do we need to know? Yes. She was very adamant about this. And my little sister said, like, fuck it. Just listen to your gran. So she's told my nephews, they're teenagers. We are all debating on when we should tell my niece. She is currently 9. We don't want to freak her out. I would have no fucking problem. I would tell her in a heartbeat. Funny little joke. So yeah, I would tell her. She's a clever little girl. I'd fucking anything that's happening, I would tell her because I never got told shit about myself when I got diagnosed with my arthritis when I was 11. Mum kept it from me because I was a delicate little soul. No, just fucking tell me. I am not one from keeping information for people, especially about their health or what things to look out for and shit like that. Just no. Fucking tell them. Like my eldest niece, they come to me because they know that their mum, my sister, and my mum, their gran, don't tell her shit. Or them shit. They come to me and say, I'm worried about blah 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 blah. So, no problem, I can help. No. Tell them. Educate people. It's the whole point of this fucking stream. No, I'm not doing that. I went through years not knowing what the fuck was going on with my own body, so no, fuck off, no. And when I got my diagnosis about my genetic disorder, she kept it from me until I was just before I left the house, till I was moving out to move down to Clydebank. I said, I know you've not been telling me shit, just fucking tell me. Then a week later I left and she said, don't leave, you can stay. I said, no, why did you don't tell me half the stuff that I need to know. No, I don't hold back on that, because no, they gaslit me for fucking years. I'm not going through it again. And I would never do that to my child. That's cruel. Just fucking tell. My youngest sister is now relented, and if the boys want to come to me, they do. They ask me shit. Like, they ask me about my blood clots. I said, how does that happen? HRT. Not moving enough. Drink plenty of water. Didn't do that. So yeah, they've all kind of broken down over the years. Because I was so adamant that just fucking tell them. Because they tell me and they swear me to fucking silence and said no. So they've kind of tried to block me from not learning stuff, but the boys, my nephews, and my eldest niece suspected things, and they came straight to me and I fucking told them. I remember having a screaming match with my mum about something that I'm not going to tell you about, because it's not about myself. So no, I have no problem saying to my mum, my dad's dead by the way, they divorced when I was 6. So no, I have no problem going up to my mum and saying that don't fucking do this. I will, if they come to me, I will fucking tell them. So they've relented. They started changing when I was about 35, so for about the last decade. Instead of my nieces and nephews coming to me and asking. I've been blocked from speaking to my youngest niece though. No, I'm on a Pixaban. They try not to prescribe warfarin too much. Boomers get it. It helps with rejection issues if you get a transplant, and because the body think, what the fuck's going on here, it changes the way the immune system, the immune response works. And so older boomers and younger boomers, so they're the ones that are on warfarin. Don't get me wrong, there's probably patients as young as myself who've been put on warfarin in other areas and stuff across the globe, obviously. But it's mostly boomers who get put on warfarin, and they've been on it for fucking years at this point, most of them. They can't take them off it now, because if they do, there's complications that they might actually form embolus. Or if they have had transplant surgery, the body will just revert back, and the immune system will go straight for the donor organ. And at that point, the medical system of whatever country you're in panics saying, fuck, we shouldn't have taken the patient off the warfarin, and now they have to do a whole transplant again because the immune system just went straight for it. No, I'm on apixaban. It's a lot easier. It's better. It shows better long-term outcomes for the patient. So my apixaban's sitting over there in the wee metal. It's not actually in its bag. All my pills, all my meds. My apixaban. It was on 10 milligrams. Well, technically I was on 50 milligram injections when I was in the hospital for 10 days. Then for 2 days after that, I was on 10 milligram pills, then dropped down to 5, and now I'm on 2.5 milligrams. And as long as I'm fine with it, I'll get checked every so often. I'll take bloods and all that, and I will discuss it. I go to see my haematologist again in January, and we will discuss it again. So that I might be on it for like a year after the event, which was in March, a week after my birthday. That was a fun fucking month for me. Whew. My mum done her best as well, bringing up 3 daughters on her own. Like my youngest sister, she was a toddler. She wasn't that old when they divorced, so she can't remember biological dad. Oh no, I love my mum desperately. She's brilliant. She's raised us really well. But I can't abide by her keeping shit from me, especially where health issues are concerned. She should know better. She was in the NHS for over 40 years.
Surprisingly, in many people, especially those with diabetes, which affects the nerves that carry pain, a heart attack may be silent. If you think that someone might be having a heart attack, the most important thing is to respond quickly. If you have access to emergency medical services, call them. They're the fastest way to get to a hospital. Taking aspirin, which thins the blood, and nitroglycerin, which opens up the artery, can help keep the heart attack from getting worse. In the emergency room, doctors can diagnose a heart attack. They commonly use an electrocardiogram to measure the heart's electrical activity, and a blood test to assess heart muscle damage. The patient is then taken to a high-tech cardiac suite, where tests are done to locate the blockages. Cardiologists can reopen the blocked artery by inflating it with a balloon in a procedure called an angioplasty. Frequently, they also insert a metal or polymer stent that will hold the artery open. More extensive blockages might require coronary artery bypass surgery. Using a piece of vein or artery from another part of the body, heart surgeons can reroute blood flow around the blockage. These procedures reestablish circulation to the cardiac muscle, restoring heart function. Heart attack treatment is advancing, but prevention is vital. Genetics and lifestyle factors both affect your risk, and the good news is that you can change your lifestyle. Exercise, a healthy diet, and weight loss all lower the risk of heart attacks, whether you've had one before or not. Doctors recommend exercising a few times a week, doing both aerobic activity and strength training. A heart-healthy diet is low in sugar and saturated fats, which are both linked to heart disease. So what should you eat? Lots of fiber from vegetables, chicken and fish instead of red meat, whole grains, and nuts like walnuts and almonds all seem to be beneficial. A good diet and exercise plan can also keep your weight in a healthy range, which will lower your heart attack risk as well. And of course, medications can also help prevent heart attacks. Doctors often prescribe low-dose aspirin, for example, particularly for patients who've already had a heart attack and for those known to be at high risk. And drugs that help manage risk factors, like high blood pressure, cholesterol, and diabetes, will make heart attacks less likely too. Heart attacks may be common, but they don't have to be inevitable. A healthy diet, avoiding tobacco use, staying fit, and enjoying plenty of sleep and lots of laughter all go a long way in making sure your body's most important muscle keeps on beating.
Yay! Woohoo! Stupid bloody legs. Excuse me while I just shake my legs a minute. Oh, thank you, Sozzled. God damn it. Oh, ew. God, that hurts my neck. Ouch. Because my spine doesn't sit properly, it's in the wrong position, there's a sort of mini little hump just here. Just got the nape of your neck here. Then there's an odd, I don't know what to call it, bony outgrowth if you want to wish, if you call it. So it sits right there, and it sort of dings things when I sneeze into. Rejoice, comrades! James Holmes is here. Hi, James. Welcome. We are doing health issues tonight because I went for a cardiac stress test, known as an echocardiogram stress test. They put leads on me, 16 leads, hooked me up and made me go on a treadmill. My joints hate me. So it starts off just your flat normal treadmill, then they raise it up and make it go faster, like you're going uphill. But my knee gave out before I got even halfway. Oh my god. Ooh! Oh, I like those. Those are fun. 1, 2, 3, 4, 6, and 4, 6, 4, 6, and 8. I have seen in lots of other people's chat. Especially a lot of 4. That little heart one is really quite cute. Ooh, what the? Huh. Do. My favourite cardio. Oh god, there'll be ads. Oh, fuck it. No, there won't. I'm on premium. Unless he's doing a sponsor. Any superpowers found? The superpowers to bully family where health's concerned. If that's a superpower. Being able to explain kind of complex health issues. Kind of. Again, not medical advice. Not a doctor. Crazy woman on internet. Who is currently in Japan. I will say that every time I bring it up. Our government are fucking idiots. Real channel videos. Huh? Yeah. I'll go to the playlists actually. In fact, you know what? I will be back momentarily, comrades. Please bear with me. Hmm. Doo-doo-doo-doo-doo. I be back. Hello. Playlists. Playlist. The polls, I've got them in second in some areas. I haven't checked. I'm scared. I live in Glasgow. I have faith in my fellow Glaswegians. Either that or I'm too fucking feared to check the polls for Glasgow specifically. Perth's looking good though. Perth's looking fine. Because obviously people from Perth are very intelligent and know what the bastard's about. They don't even have a fucking office up here, for crying out loud. But don't get me wrong, there's plenty of time for them to set one up and gear up for next year. Obviously, I will be saying to everyone that I get in contact with that I can literally scream at, do not vote for the fucking lunatics. I don't trust them. I don't. Fuck off, man frog. Seriously, no. I hope they lose all their fucking deposits in every fucking seat that they run in. The list is a different beast, obviously. It's a different equation that goes into that one. They might get MSPs on the list. But we will see. I will be gearing up towards it round about my birthday. So I will celebrate my birthday. Then the day after that, I will literally be gearing up and highlighting things that are getting broadcast. Hang on. I was thinking it might be that week. So, let me... holy fuck. If I've got this worked out correctly, it will be the week that St. Patrick's is in. That's when it will be called, and it will be in May. I believe, but it's yet to be said. It's going to be in the first 2 weeks of May, by the way. So yes, so either a week or 2 weeks after my birthday. Delightful. So I'll be gearing up for it. So I'll celebrate my birthday, yay, then dive right into it, headlong into election coverage, and you'll probably see me lose my fucking mind over it, screaming into the void and all sorts of other nonsense. So look out for that, me losing my shit if Reform's polling gets better. If I have anything to say about it, I'll stay right where it fucking is. Yeah.
Good morning. It is 2:56 a.m. Welcome back to the hospital at night. I've just finished my 11th or 12th case of the day. I'm going to try and skulk off to bed. I'll leave my registrar to fend for himself. He's a big boy. He can manage. But before I go to bed, I wanted to share two extremely curious phenomena with you in medical science that remain poorly understood to this day, especially the second one. They're fields of ongoing research, including my own tiny contribution to the field. The first is something that will sound completely counterintuitive, where reality is exactly the opposite of what you would instinctively expect. And the second is a discovery that is equally fascinating and that promises so much, but we'll get to that. I've often thought about sharing this stuff, but I figured it's a bit niche or academic, so I don't know. But I thought while I'm in my no-frills video era, it would be a good chance to share some science, which is indeed cool, but most importantly, doesn't require me to do any research before recording because I already know about it. And there aren't many fields that I know enough about to speak without looking anything up. And since I didn't think you wanted to hear me talk about cricket or 1980s synth music, I'll stick to medicine. And I chose something that I know especially well. It's the field that I did my PhD research in. So I'll start by setting this in. Well, this is kind of like, I like Hank Green's sitting at a desk explainers. So this is my tribute act, albeit with more pauses for breathing. Your arteries carry blood to your body. Occasionally they block. Well, the treatment for that seems obvious. Unblock the artery, and that is indeed what I do. A little insight into the high level of comedy and repartee that I treat my patients to is I usually quip that I am ultimately just a plumber.
You're not a plumber.
I'm a plumber. But what if I told you that the act of unblocking that artery, whether it's supplying the heart, a kidney, a brain, or a leg, actually caused more damage? This is
chocolate and Guinness cake. There's a pub slash bistro called the Barfly Pig here in Glasgow. Fucking love the place. I had my wedding meal there. God, I love it. Guinness and chocolate cake. When I said to my mum where I wanted to have my wedding meal, I told her about this place, and the very next day she came through, said, I'm through, I'm in Buchanan bus station, come down now. What the fuck? She said, where is this place? I need to see it. So we went to the tea rooms at the top, which is on street level, and the pub goes 1, 2, 3, 4. Okay, 4. Down and so below street level is the pub bit. Next one up is extra dining area. Then we were one more up. It's four. So pub at the bottom, tea rooms, more dining area, private function rooms. So I was on the 4th floor. It's a Georgian townhouse, by the way, on Bath Street. So yes, I love the place. So she came through the very next day, literally hours after I talked to her, because I have to see this place. So we went to the tea rooms first. Some Guinness and chocolate cake for me. A strong spark coffee, tall one. She had a sandwich, and she had a banoffee cheesecake slice. And my niece, who was, yeah, she'd be 18 at the time. She was 18 at the time. They were 18 at the time. Sorry, darling. She had a scone with jam and clotted cream and a cup of tea, or a pot of tea. So, brilliant. I said, right, we need to try the food. So we went downstairs. I got an ale. Mum got gin. And my niece got a cider of some description, a bottle one. Is it a Copperberg or a Recorderlig? I think it might have been a bottle of Recorderlig they got. And we had food. Seriously, that was just so fucking random. So, if you ever comes, I have no idea if they still do the Guinness and chocolate cake. I would assume so. If you ever come through to Glasgow, just get directions for Butterfly Pig on Bath Street. For me, my mum and my niece, it was a 20-minute walk because basically a cripple, the arthritis walking stick. Mum would have been, this was 8 years ago. She would have been in her early 60s. And like I said, my niece was 18. So it was good, and it took us just slightly over 20 minutes to walk to it from the bus station. And she says, I approve, I will pay for your meal. She ended up paying for the entire wedding. Thanks, Mum. I bought my dress. She did it. She wanted to leave that to me because I've got I know what I like. She was worried I would buy a meringue. With this body, fuck off. And plus it's a meringue, I wouldn't even, your big fucking fluffy looking things. Don't get me wrong. If the bride likes wearing big fluffy looking dress, carry on. I don't. $30, $50, just went up. Fucking ridiculous. 50p. Some black. 10 seconds. There we go.
But what if I told you that the act of unblocking that artery, whether it's supplying the heart, a kidney, a brain, or a leg, actually caused more damage? This is something called reperfusion injury, and it really does boggle the mind. Heart attacks continue to enjoy tremendous popularity among the general population and ensure that my job is effectively recession-proof and I think probably AI-proof as well, at least until I retire, which frankly cannot come soon enough. Heart attacks, of course, are arterial blockages. Evolution, in all its foolishness, decided that this organ that has to beat continuously your entire life, it cannot even stop for a few seconds, or you die, and thus it requires a constant supply of juicy, oxygen-rich blood at all times. And by the way, the organ that supplies that blood is itself truly the most hustle and grind organ, who would doubtless post inspirational TikToks preaching self-sufficiency if it wasn't so busy working around the clock, supplying the whole ungrateful body with blood, even the stupid brain, whose sole contribution is cake, cigarettes, and a constant supply of stress that literally no other part of the body is thankful for, or the liver, who just shovels toxic cholesterol out like waste oozing out of a sewage processing plant. Don't even get me started on the mouth, who hasn't met a chip it didn't like. What about the pointless pancreas, who has like 2 jobs and manages to balls up both of them? And then we come to the sorry sausage of sick that calls itself the bowel. The microbiome. Shut the fuck. Apparently that's a trigger for me. So evolution, or whichever incompetent drunk designed the heart's blood supply, decided that this organ that cannot stop should be supplied by weedy little arteries that have a predilection for blocking.
Thank you for dropping by, James. Always a pleasure. Stay hydrated. Self-care. Stay based. Good night.
Now, when one of these arteries blocks, interrupting the blood supply, that's a heart attack. Now, most heart attacks cause some damage to the heart, but the spontaneously opens up again, the clot passes, and then, they're a bit more stable. But in many cases, the artery remains blocked until it is unblocked by people like me in places like this. These are the major class of heart attacks, and these are the ones that cause the most harm. So they're the ones that need emergency treatment. Now, you might think that the damage is done when the artery occludes, that the blood supply is cut off and the cells, which consume large amounts of oxygen and nutrients, heart cells are metabolically very active, they have high numbers of mitochondria, quickly become ischemic, which means starved of oxygen. And then they become necrotic eventually, which means they die. And that's true. That does happen. That is a source of damage. But there is a two-hit phenomenon. Now, you might have seen some news recently that the death rate, the mortality from heart attacks has plummeted over recent decades. And it's an incredible success story. It's what few areas of medicine have seen such an amazing transformation. Indeed, one that really inspired me to go into the field. Those of you under the age of about 30 might not realize that before the year 2000, heart attacks claimed so many young lives. People in their 30s, 40s, 50s, just dropped down dead. I mean, I'll put some charts on.
Holy fuck. Hang on. A4. Wow. Yeah, they have been coming down. That is good. Not bad. Thank you, Sozold, for dropping by. Always a pleasure. I love it when you're here. It's great. It's always great having you here. You've been such a good help to me. Luckily, no bot raid, no raids, no idiots, no fucking people being wank. I think they've given up. Do not piss off this Scottish woman. Trust me, we'll just come straight for you. And we don't need to be violent about it. We don't need to use physical violence. We can cut you with a razor-sharp wit. Thank you, Sozold. Stay hydrated, self-care, stay based. Catch you later.
the screen, but look at the reduction in deaths. It's truly amazing. This is thanks to better medication, better inpatient, outpatient care, better nursing, better rehabilitation after heart attacks, better pacemakers and devices, and of course the rolling out of emergency stenting procedures, which have saved millions of lives, and perhaps just as importantly allowed me to start a YouTube channel predominantly based around me being in the hospital at night. But we are now very good at opening up arteries. We manage that within about 20 minutes of a patient arriving. In many countries, if you have one of these major class of heart attacks, you no longer go to your local hospital, you come somewhere like this to a heart attack center. But that's only half the equation. The reperfusion injury that I mentioned seems to inflict a second hit on the tissue that was up until that point starved of oxygen. The very process of restarting the blood flow has directly caused damage. So why? And why does this only occur in some cases? These questions fascinated me so much that I ended up going into the field, and my projects were looking for ways to prevent this. Now you might wonder, if we know it does harm, why even bother opening up the artery? And that's a fair question, but we know that overall, opening up the artery is definitely the right thing to do. In many cases, patients would simply die if you didn't. And most of the time, like in all my patients today, for example, as soon as you open up the artery, the patient stabilizes, they immediately look better, they feel better. And this is one of the reasons I love interventional cardiology, because I'm one of the world's most impatient people, and immediate results are my love language. Hello from the daytime. I've actually spent the last few days trying to recover some inexplicably corrupted video files. I don't know what went wrong, so I managed to salvage all of it except for this little chunk. So what I was saying during this point of the video was that sometimes a patient's pain actually gets worse when we open up the artery, and you can imagine this fills them with dread. They've come into hospital with a huge heart attack, and then some clown whose jokes are middling at best has actually made their pain worse, and it's demoralizing for the treating team as well. The last thing I want to do is inflict more pain or injury on a patient, but that's literally what's happening. And something I sometimes use to explain to patients is not physiologically an accurate analogy, but I think it helps kind of sort of frame the problem. You know, when you sometimes sit in an awkward position, you don't notice your leg going to sleep, but when you stand up, that's when you get the pins and needles and the pain. And it's a similar kind of phenomenon. It's when the blood starts flowing again. Of course, pins and needles in your leg is not caused by the blood being cut off to your leg. It's more to do with the nerve being compressed, but you get the idea. I think it's a useful framework to help people understand. It could be summarized as saying, you know, things get worse before they get better. In fact, that's kind of the TLDW for this whole video. So what is actually going on? Well, we don't fully understand, but we know some mechanisms that are involved. As oxygen and nutrients are cut off to the cells, then ATP levels fall. Now, ATP, you'll remember, is the kind of energy currency used by the body. The tissues become acidic, and the little pumps that you get in the cell membrane, the ion pumps,
adenosine triphosphate, if you want to know, it's part of the Krebs cycle, and how the cells work, how you get energy and stuff. I learned it at secondary school, that cycle, the Krebs cycle, so it should still be in the curriculum for secondary school. It's like 14, 15-year-olds. But it might be in higher now, could be in the higher, which is 16, 17, and 18. So that's part of the...
that regulate the concentration of sodium and potassium and things like that fail. You get an intracellular buildup of sodium. This draws water into the cells, and that's edema or swelling. So the tissue becomes very edematous, inflamed and swollen. Metabolic activity starts winding down, and the cells, like fish out of water gasping for air, start to fade and die. But then when the artery is opened up, boom, reperfusion. Suddenly a red tsunami of oxygenated blood cascades in and bathes the vascular beds in what they've missed so badly. And yet this brings a second wave of destruction. Incomplete reduction of oxygen in damaged mitochondria produces reactive oxygen species. That's oxygens with an unpaired electron in their outer orbit, aka oxygen-free radicals, superoxides, hydrogen peroxide, hydroxyl radicals. They're all formed. They all damage tissue. They cause things like cell membrane dysfunction, the lipids, or protein and DNA damage. Inflammatory pathways are kicked into overdrive. White cells infiltrate the tissue. Complement, which is part of the immune system, the immune response is activated. Inflammatory cytokines are released. Calcium floods into the cells. Now, for reasons are too long to go into here, calcium just royally f***s everything up. I mean, to quite an impressive degree. Cell damage, further reduction in ATP. Calcium, it's like a crazed calcium cowboy that just comes into the saloon and starts shooting the place up. So not only can the patient feel more pain, but they can also become unstable. The pumping function of their heart can suddenly deteriorate, causing the blood pressure to crash. They can have a cardiac arrest. It does at least ensure that everybody in the room is paying attention. We're quite comfortable dealing with these complications, and thankfully it almost always passes and the patient stabilizes, but unfortunately the heart does take this double hit. An interesting visual demonstration of this is what we call the dreaded no reflow phenomenon. When you unblock an artery normally, you inject dye and you see the artery suddenly reappear and a big hose pipe fills the screen. Great feeling. But in no reflow, even when you've relieved the blockage and you put a stent in, you inject the dye, nothing happens. The vessel simply doesn't fill with dye because the blood in the artery is just sitting there, unable to go anywhere, because the vascular bed that it's supplying is so swollen and angry and inflamed, the capillaries are all squashed shut. The patients who are most at risk for this are those who waited hours and hours before calling an ambulance, as the longer the ischemic time, the less likely you are to get a good result. And it is, again, demoralizing to do all that, and then at the end of the procedure, you get this no reflow. So one of my projects was doing MRI scans on these very severe heart attacks, and even the MRI dye a few days later still cannot penetrate the area of damage. But in the worst cases, we actually saw hemorrhage. The blood vessels had ruptured, causing bleeding into the heart tissue. And this doesn't just occur in the heart. You can see the same phenomenon in the brain after a stroke. Most strokes are caused again by an interruption in the blood flow. So technically, to be consistent, we should call them brain attacks. But if the blood flow then returns to the area of damage, then you can get reperfusion injury and you can get something called hemorrhagic transformation, which is bleeding in the brain, and I'm sure I don't have to tell you that is bad news. And this brings me to attempts to prevent reperfusion injury, and the second crazy thing I wanted to tell you about. Back in the 1980s, a decade of course known for its pioneering synthesizer evolution and innovative sampling. Sorry, wrong video. Someone discovered that if you create temporary ischemia, a little soupçon of hypoxia, a few times before a heart attack, the heart attack is actually smaller. This, as with so many discoveries, was found in animal studies. It was in a dog. So if a balloon was blown up in a dog's cardiac artery for a few minutes, blocking it, the balloon was brought down, blocked again, unblocked, several times, and then a heart attack was caused by permanently blocking the artery. And the heart attack was smaller than if it had occurred without all of that preparation. So that was weird. But then somebody else noticed that you don't even need to blow up the balloon in the same artery that you go on to block. Any cardiac artery will do, even if the heart attack is in a different territory. And so then somebody thought, well, if it's in a different territory, why not a different organ altogether? Let's not fiddle around in the heart, which of course is very difficult. Why don't we block the artery supplying the kidney, which is much easier, isn't it? I mean, whomst among us hath not blocked a renal artery? So they caused these cycles of ischemia in the kidney, and then the heart attack was still smaller. So what is going on here? The kidney is nowhere near the heart. Then somebody realized you don't even need to do anything invasive at all. You can inflate a blood pressure cuff on the arm to cut off supply to the hand temporarily, just for a few minutes, like a tourniquet, and do that a few times, up, down, and bingo bango, the heart attack is still smaller. This is remote ischemic preconditioning. So what on earth is going on? Why would temporarily causing a bit of harmless ischemia in the arm mean that a heart attack is in the heart is smaller? Well, in a sentence, we don't really know. There are, of course, many mechanisms implicated, and our understanding has grown in a large part due to the research team that I was briefly part of, who have been pioneers in this field for decades. But in the interest of time, because it is 3:21 in the morning, I have whittled on for, this is way longer than I thought. I had to stop in the middle to I brought a memory card that was completely full, so I had to empty it. But I always drastically underestimate how long I'm capable of waffling on for. I won't go into the details, but humoral mediators like the release of certain protective chemicals into the bloodstream, the nervous system may be involved, intracellular signaling pathways, enzymes, molecules, all of which serve to blunt that the reperfusion injury, meaning the ATP levels are higher, and that whole carpet bomb of chaos that I mentioned earlier is reduced. And the first time I learned about this, it really did seem like magic. And then furthermore, if all you need is a blood pressure cuff, which every hospital in the world has, no medications are needed, no invasive procedures, no skill is needed to inflate a blood pressure cuff, there's essentially zero cost, zero risk. Why has this not been taken up around the world? Because, of course, causing a heart attack in a dog in a research laboratory in a planned manner is not the real world. No one knows when they're going to have a heart attack. They can't do this 25-minute ritual before they have a heart attack. And by the time the heart attack has started, it's probably too late. This was the major study that I was part of, a multi-center, blinded, randomized, international controlled trial to see if remote ischemic preconditioning could reduce the size of heart attacks, and spoiler, it didn't. We concluded that not only has heart attack care improved so much that incremental benefits are harder to demonstrate, but also that starting the cycles of ischemia in the arm after ischemia in the heart is unlikely to work, even if it comes before the reperfusion. However, not all ischemia is unexpected like a heart attack. Think about heart surgery where somebody's heart is stopped before going on a bypass machine. Think about a kidney removed from an organ donor. It will be ischemic until it is reperfused in its new home inside a grateful organ transplant recipient. So these have been areas of interest for remote ischemic preconditioning as well. Like with all medical research, and a reason you should ignore 95% of what people like Andrew Human or Brian Johnson say, results obtained in small studies, in laboratories, and animal pilot studies simply don't translate into the real world. Every small study and proof of concept study we did showed a clear benefit, but when we tested it in the big, bad, wide world, the results were disappointing. Plus, it should also be said that organ transplant and cardiac surgery have improved so much that, again, showing a small incremental benefit is hard. But if it continues to be an area of research around the world, I do hope it finds a place. I think it's unfortunately developed a bit like precision medicine or stem cell therapy or widespread driverless cars or India being successful at the Olympics. There's a lot of potential, but it's always just a few years away. You know, I've just had a thought. I've gone about this whole thing the wrong way, haven't I? I should have marketed this from the start as a wellness cure. It makes so much sense. All this time I've been worrying about a lack of real-world data and neutral human randomized controlled trials, but that no longer matters anymore, does it? There's a forum for medical interventions that lack evidence. Podcasts. Unlike stuffy medical journals that are only read by industry shills who insist on high-quality evidence, podcasts positively look for small animal studies and poor-quality observational research. I should rebrand myself as a wellness guru, podcast bro, and convince people to adopt my new wearable technology, put it on their upper arm like a CGM. It works so well. I mean, it'll be nicely branded. It'll cost $800, $750 with my discount code. But it's basically just a BP cuff that inflates and deflates a few times every morning. I need to drop a Ashton Hall morning routine, don't I? I could say I'm biohacking while meditating or hovering above a pool for a few minutes. Oh man, I wish I'd thought of this at the beginning of the video. I could have started it off. Well, I guess you are watching a business idea hatch in real time. This is where I make my millions. Get your midlife crisis, remote resilience, cardioprotective, prepper, tech, wearable 3000 now. Surely all those wind bags that wang on about saunas and dopamine and UV light and cellular pathways, they should love this, right? All right, let me know if you even made it this far. It is 3:32 in the morning. It's time for me to go. It's been a real torrent of information. I hope I haven't induced any information perfusion injury to your brains, trash organs that they are. See you next time. Sure. 1 minute left on the card. Perfect.
That might have worked. Shame the human body is fucking weird. I think that is enough medicine, or health related. Let us cover some politics, shall we? Right. News. Oh, fucking hell. Oh. Oh, no. Right. Please don't make me come out of... Ugh. Where is it? Oh, right. I'm gonna have to do it this way, right? Oh. Do 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 do. Okay, demo. Demo. Go. Demo.
Right, so at a time when the UK already faces growing condemnation both at home and abroad for its ongoing material and diplomatic support of Israel's genocide of Gaza, it's not Keir Starmer or David Lammy that is today the target of public enmity over their pro-Israel proclivities, but the Speaker of the House of Commons, who finds himself at the centre of a deepening scandal, and one, once again, all of his own making. Sir Lindsay Hoyle's decision to block the release of his own communications with Israeli officials has relieved not only what would appear to be a personal lapse in judgment, but a far more profound institutional crisis as well, because this is not some minor procedural dispute here. This is the guy whose job it is to uphold parliamentary standards and rules, appearing to be hiding his own actions now. The principle of democratic transparency is clashed with parliamentary privilege, because domestic transparency doesn't apply here. Privilege has won out. The result, therefore, has been secrecy and impunity, and a chilling message to the British public that the Speaker answers to no one. The effect being that they are above the rules and regs that they are there to supposedly oversee. It's just not democratic, is it? So, can we do anything about this then? Right, so the Freedom of Information request in question that has triggered this scandal that's now engulfing Lindsay Hoyle, submitted by the excellent investigative outlet Declassified UK, has sought written correspondence between Hoyle and key political figures surrounding the events of the February 21st, 2024 debate on Gaza in Parliament. This was the same debate where Hoyle broke with parliamentary precedent to allow a Labour amendment, effectively neutralising an SNP
Weird.
motion calling for a ceasefire to be voted on first, suspending a standing order to do this, so the optics of this move and the motivations of it were heavily questioned. The consequences of that decision were immediate and they were severe. A political storm erupted. Dozens of MPs signed a motion of no confidence in Hoyle. Public anger over Westminster's pro-Israel bias boiled over. It was against this backdrop that the refusal to release Hoyle's emails appears not as a routine administrative discretion, but as a deliberate concealment of potentially damning political conduct. Hoyle's apparent suppression of his correspondence during a genocide-related parliamentary controversy reflects not only his own allegedly compromised role, but the broader moral collapse of the UK's political institutions in the face of this ongoing mass atrocity. By invoking parliamentary privilege to seemingly bury evidence of his interactions with Israeli officials, Hoyle's moved from speaker to shield, in effect, from referee to a partisan actor, protecting not parliamentary democracy, but the UK's ongoing complicity in Israel's crimes in Gaza and whatever role he might have in that himself. Because it does make him look rather guilty of something, doesn't it? It does look like he's got something to hide. To understand the gravity of Lindsay Hoyle's actions now, let's start with the events that prompted Declassified UK's FOI request. Just a bit of a refresher in case we've forgotten about it. The February 2024 Commons debate on Gaza has been one of the most harmful occasions to Hoyle reputationally where it comes to Israel. Initiated by the Scottish National Party as part of an Opposition Day motion that they had brought, the debate was designed to put pressure on the UK government to support an immediate ceasefire in Gaza. And the timing of this was crucial because Israel's bombardment of Gaza just reached new heights of brutality. Thousands of civilians had been killed, aid convoys were being blocked or targeted, hospitals were being destroyed. We know what was going on then, and we know that it has continued ever since. So as you can imagine, the world was watching this. Would the UK vote for a ceasefire? Under long-standing parliamentary convention, opposition motions are debated on their own terms. Amendments can be tabled to them, absolutely, but the motion's original wording is respected, and therefore it is voted on first. In this case, however, Hoyle made the unprecedented decision to allow a Labour Party amendment, far weaker in its language and more sympathetic to Israel, to be debated and voted on first instead, in defiance of convention. And this effectively displaced the SNP's original motion, therefore, and avoided forcing Labour MPs to vote explicitly for or against a ceasefire. This breach of precedent enraged opposition parties and prompted accusations that Hoyle had acted as a
case in point, the government, the Labour Party, the party in control of the country, managed to get to the Speaker in some sort of shady fucking offer or whatever to do this. Went against procedure. Unwritten, we don't have a written constitution, blah blah blah, or things are laid out. These are long-standing. They're centuries old, essentially. The way things are meant to work, but they nobbled the Speaker. They got to Hoyle in some sort of fashion, I believe. Stopped the SNP from going first, which is usually how it happens. And at that point, they probably lost hundreds of thousands of Scottish voters going against our MPs. Of thousands at least. No, it would be hundreds of thousands because it was 9. So, just going on the standard 75. 150,000. So say about 500,000, 500,000. So it's meant to be roughly 75,000 per constituency, including my own hometown, my home city of Perth. That's Pete Wisher, by the way. Just like, no, our voices were literally silenced when that happened. Mine wasn't. My MP voted for this weaker amendment that went first because she's Labour. So yes, thousands of Scottish voices just silenced. You don't matter. Thank you. Got the message loud and clear. Thank you. Fuck off. I hope, Labour get fucking punished for that, and for that one at least. Because thousands of Scottish voices just blatantly not listened to. Is that the way you want to treat us? Fine. We'll do the same back to you at the polls. Bastards.
Shield for Keir Starmer, rather than a neutral guard in a parliamentary process as he is meant to be. The day unfolded chaotically. Labour, fearing a rebellion amongst backbenchers and members, outraged by its ambiguous position, drafted its own amendment that softened the demand and reinforced Israel's right to self-defence. Hoyle's decision to allow this amendment to take precedence over the original motion was an unprecedented manoeuvre. SNP MPs stormed out in protest. Hansard records reflect calls from multiple MPs questioning Hoyle's neutrality on the floor of the House. A motion of no confidence was tabled, signed by more than 70 MPs across party lines. Hoyle issued a qualified apology, stating that he had allowed the Labour amendment to protect MPs from intimidation, citing attacks on MPs previously as his concern. But he hadn't mentioned it previously in the days running up to it. Didn't mention it until he came to offer his apology for his actions. Civil society groups such as the Palestine Solidarity Campaign issued statements condemning what they saw as the silencing of principled opposition to the UK's complicity in Gaza. The damage, however, was done. A precedent had been shattered. The neutrality of the Speaker had been called into question, and the suspicion of political interference by outside actors firmly planted in the public consciousness. And Hoyle has never really shaken this, I don't think, and he certainly hasn't helped himself now. Following all of those events, therefore, Declassified UK submitted a Freedom of Information request to the House of Commons on the 22nd of February 2024, the very next day. But it's taken this long to get a response. The request sought copies of all communications, including emails, messages, transcripts of calls, meeting records exchanged between Hoyle and several senior Labour figures, those named in the FOI request, including Keir Starmer, Sue Gray, David Lammy, Annalise Dodds, Alan Campbell, and Pat McFadden, between the 19th and 21st of February. That was the 3 days they wanted this information covering. So in the days running up to this vote. And the request specifically asked for the materials relating to the Gaza debate, the Israeli-Hamas war, the procedural decisions regarding Labour's amendment, and any discussions of Hoyle's own position as Speaker or peerage prospects. The Information Commissioner's Office, the ICO, in its published decision notice, confirmed that the request was blocked by Hoyle personally, who had issued a certificate under Section 34(3) of the Freedom of Information Act of 2000, a clause that allows public authorities to exempt information relating to proceedings in Parliament if they believe disclosure would prejudice parliamentary privilege. The use of this certificate is rare and is highly controversial. By law, a Section 34(3) certificate makes the exemption conclusive. The ICO cannot override it. The requester cannot appeal it in court. It operates as a legal black box, in effect. That's it. Even if the content of the emails would reveal undue political interference, or collusion with foreign officials, or the suppression of democratic debate, the public has no right to see them, so says the Speaker. Although it's not written explicitly so in law, the de facto effect of this is to place the matter above the law. So this is not simply a procedural matter to be accepted and moved on from. It's a direct affront to democratic oversight. It is just fundamentally undemocratic. The legal basis for Hoyle's refusal lies in two primary texts, the Freedom of Information Act of 2000, specifically Section 34, and the Bill of Rights of 1689, particularly Article 9. The former permits the withholding of information relating to parliamentary proceedings if privilege would be prejudiced. The latter enshrines the principle that the freedom of speech in debates or proceedings in Parliament ought not to be impeached or questioned in any court or place out of Parliament. These principles are vital to protecting parliamentary independence on one hand, but when deployed to suppress evidence of the Speaker's private conversations about a foreign conflict, one under investigation for genocide at that, the net effect is corrosive to say the least. Privilege becomes not a shield for democracy, but for its distortion. In this case, the privilege does not protect parliamentary speech, but potentially shields a political fix orchestrated behind closed doors outside of any formal proceeding. Moreover, it is critical to note that the Speaker has a direct personal interest in the content of the blocked communications. He's not merely an institutional officer guarding abstract principles here. He is a party to the correspondence, the subject of the allegations, and the final authority over whether the evidence is released. This is a profound conflict of interest, one that would be unacceptable in any court of law or ethical oversight body, yet it is fully permitted within the opaque, archaic architecture of British parliamentary privilege. Lindsay Hoyle's actions and suppression of correspondence with Israeli officials comes in the context of a personal and familial political history steeped in pro-Israel advocacy as well. His father, Lord Doug Hoyle, was a co-founder of Labour Friends of Israel, the LFI, one of the most influential foreign lobbying groups in Westminster. Doug Hoyle was instrumental in founding LFI in 1957 and maintained close ties with the Israeli Labour Party throughout his career. Lindsay Hoyle has publicly acknowledged and praised this legacy, referring to his father as a proud friend of Israel. Well, personal admiration for a parent is not in itself damning. We're all proud of our parents in our own ways, of course. The Speaker's actions, blocking transparency over his own Gaza-related conduct while celebrating a family history, or having a family history tied to pro-Israel lobbying as he does, it all raises serious questions about impartiality and ideological bias on top. These concerns are magnified, therefore, in light of the Speaker's decision to protect Labour from scrutiny during a Gaza ceasefire debate, and to then suppress records that might reveal collusion with either Labour leadership or Israeli officials. This incident is part of a broader pattern of British complicity in Israel's ongoing assault on Gaza that so many of us are heartily sick of now. The UK continues to license arms to Israel despite overwhelming evidence that those weapons may be contributing to war crimes. According to the Campaign Against Arms Trade, CAT, the UK has licensed at least £474 million worth of arms to Israel since 2015, including components used in drones, fighter jets and tanks. This is in direct contradiction to the UK's obligations under international law, including the Arms Trade Treaty and the ICJ's interim ruling, which imposed provisional measures on states aiding in potentially genocidal actions. Diplomatically, the UK has acted as a consistent shield for Israel at the United Nations, voting against or abstaining from resolutions calling for accountability and ceasefire. It has also issued statements justifying Israel's military actions under the guise of self-defense, despite the asymmetry of force and the scale of civilian casualties, not to mention the fact the self-defense argument doesn't apply in the context of an occupied people. They have a right to resist occupation under international law. The Hoyle affair, therefore, becomes not just a matter of parliamentary secrecy, but one node in a web of institutional complicity stretching from Whitehall to Westminster to the Foreign Office. Historically, the UK has a long tradition of hiding or delaying the release of information related to human rights abuses and foreign policy misconduct, from the Chagossian expulsions to the Iraq War legal advice to the colonial-era suppression of the Mau Mau torture archives. Hoyle's actions follow this well-worn pattern as well. Suppress the truth under the guise of legal propriety, even when lives are at stake. But unlike those cases, the cover-up here is not decades old or buried in bureaucratic archives. It's live. It is happening during an ongoing genocide. The implications, therefore, are absolutely dire. Hoyle's refusal does not merely undermine trust in the speakership, it strikes at the legitimacy of Parliament itself. If the Speaker cannot be held to account for suppressing correspondence about possible collusion with a foreign government during a genocide debate, which is the conclusion we are drawing, is it not? Such are the optics. Then what mechanisms of democratic accountability remain? If parliamentary privilege is invoked to override public interest in matters of mass atrocity, then what is left for parliamentary democracy? Well, there are potential paths forward here. MPs could introduce reforms to restrict the use of Section 34(3), ensuring it cannot be used to shield the Speaker's own correspondence. A parliamentary committee could launch an inquiry into the Speaker's conduct. Civil society could push for judicial review of the certificate, challenging its compatibility with the European Convention on Human Rights, Article 10, freedom of expression and information and all of that. Most of all, there must be sustained political pressure, though, from journalists, activists, and all of us, ordinary constituents, demanding transparency and accountability here. Lindsay Hoyle is hidden behind parliamentary privilege to shield himself from scrutiny, claiming it is not in the public interest. Surrounding events that are of enormous public interest, and all at a moment when the UK's role in an unfolding genocide demands the utmost of openness. His actions have exposed how privilege, secrecy and foreign lobbying can be being used to override democratic norms and moral responsibility, and yet there is no democratic tool available to correct this, which is just insane.
More traction.
And it's why this story needs to gain more traction if we're ever going to change that. This anti-democratic sentiment is being driven by the government itself, of course, not just in relation to these possible conversations between themselves, then in opposition with Lindsay Hoyle, but in how they respond to the general public too, as a Brighton woman found out to her cost when she wrote to her MP about what was going on in Gaza and her displeasure at the UK response to that, and had the police arrest her at 4 a.m. for doing so. Yeah, true. All the details of that story in this video recommendation here is your suggested next watch. Please do also hit like,
What's
share
that
and
one?
subscribe if you haven't done so already, so as to ensure you don't miss out on all new daily
I done that one
content, as
last
well as
night.
spreading the word and helping to support the channel at the same time, which is very much appreciated. Holding
Thank
power
you,
to
Demo.
account for ordinary working class people.
Fucking awesome.
I'll hopefully catch you on the next week. Cheers,
Thank
folks.
you, thank you. Hmm. Holy fuck. I've been going for 4 hours. I think I'll leave off there. Let's see who's live. I will need to come onto my stream though. Twitch? Oh yeah, I'm back on UK and Oh Christ. Ugh. Excuse me. Sorry about that. Thank you, Sorcerer. Oh god, no, I need to go into my stream, don't I? Stream manager. Oh, Sozog left nearly an hour ago. Yeah. Let's see who is live. Oh, fucking motherfucker. Oh no, there we go. Twitch. Christina. Oh, David. Rhizome. Top. Carla. Amy. Dolly. The Marxism. So, oh Christ's sake, yes, accept. Fine. There we go. A small streamer like me. Yay. Let's go and surprise Sob now.
Taking a look at specifically mathematics and philosophy of voting. I think that it is a good conversation to have, especially in this modern era, and I don't think that it is radical or not to